We're ready? All right, good morning. Thank you all for joining us today. I'm starting it today because I'm back in my own chair. I got Wance out of this seat, so I had to start it this morning. As always, we'll start with the pledge to the flag and a moment of silence. So if everyone could please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And we have priority carol, and we'll start with the Colonel, Mr. Rothstein.
Okay. And good morning there, Commissioner Wance.
You told me I had to start with you first. That's why I did it.
A few things I just want to share. One is we had we had a planning and zoning session last night, and it was the last session where we're looking at the rezoning opportunities. And I really applaud, again, our planning department under Linda Eisenberg and her entire team for really doing a lot of listening and learning in the process. And I think between that and the commission's dedication, really came up with good products that will lead us next week into discussions and workshop discussions on the rezoning decisions that we as commissioners need to make. So I think we are in a good position because of the due diligence of the planning committee or planning department and the Planning and Zoning Commission. This past week, I had a great opportunity. I'm very humbled always to provide proclamations to Eagle Scouts. And there are two Eagle Scouts from two separate troops, one on Saturday and one on Monday. Just incredible young men, being in the Scouts for 10 to 12 years, and then getting that Eagle, becoming an Eagle Scout is just something that obviously they, along with their family and community, are very proud of. And it's just always a humbling opportunity for me to participate in those events. The last thing, don't want to sound like a broken record, but it comes down to masks and social distancing. We are not out of this. We still have 210,000 plus that have died, unfortunately, throughout our country. And it is believed that masks and social distancing will allow us to get better sooner and through this pandemic. We have to lead, I believe, by example. Integrity is doing the right thing, whether people are watching or not, and that is to wear the mask appropriately and to keep distance. And if you don't want to, then stay away. But it's not for your self-preservation. It's for you along with others around you. Family, friends, and neighbors. So it's a difficult situation we're in, and I just don't want to let our guard down as we're working through this. So that's all I have. Thanks.
Commissioner, you're muted. Chris.
Okay. Thank you. That was not my fault. I want to go to air saying that. I won't point across the air, but anyway, we'll go now to Commissioner Weaver.
Good morning. Well, I guess major event here yesterday, we were all together, was the groundbreaking for the expansion to the Carroll County Technical Center. And, I am totally impressed with always have been with the Tech Center and what they've been able to accomplish. And they're always changing programs to try to keep up with the technology, what's going on in the world around them. And I remember having a student in she was part of the biotech program and didn't want snow days, didn't want to miss a day there. They were so excited about going to that school and what they were learning. And she actually said after her freshman year in college, she was tutoring the other students. She knew more than most of them did by going through that tech program. And they have some fantastic programs there, and they are expanding to even have more programs. Now, not always the same programs they've had. They're changing constantly to go with the demand for an industry demand. But I give them a lot of credit. Steve, I want to thank you yesterday for the thank you to Dennis and I, but we fought for this for 6 years to get this tech center put together, and I finally were able to see it come there. And I did ask the principal yesterday, we'll be at the ribbon cutting when they get done. So thanked her for putting everything together. The other thing is, this is beginning of the political season, I guess. So start thinking about laws and things we need to take to Annapolis to start looking at in the future. What resolutions, anything we need to have happening in Annapolis, and it's going to be upon us very shortly. So, and we do have the election coming up. Please register to vote and vote only once, but please get out and vote and do the best we can then. Okay, that's it.
All right, thank you, Commissioner Weaver. Commissioner Wentz, are you taking over now, or you want me to continue? Because it's running really smoothly.
Hey, if it's smooth, keep her rolling.
Okay, I'll continue through this part. All right, Commissioner Boucher.
Thank you, Commissioner. Commissioner Weaver, you mean we only get to vote once, not twice? All right, I have for Priority Carroll, we have 2 members of our county government that are honored through the Maryland Census Champions. The state government has recognized those individuals in different jurisdictions who've done exceptional work with the census, and that is Mr. Chris Swam and Miss Lynn Davis. There you go. We got some shots of them.
Look at that picture.
They're instrumental in getting the numbers in for our census. Look at that handsome devil there. He does a wonderful job for us. I want to express our appreciation to the work they've done, because the census really helps our county with federal grants and our redistricting. So thank you very much to those individuals for their hard work bringing those numbers in. Second priority, Carol, I have is tackle football open up. There you go. The kids and the parents were out this past weekend for opening weekend. They had a wonderful time. I attended 2 of the games. Unfortunately, the Westminster Wildcats whooped up on my Winfield Cavaliers. The Wildcats have an exceptional team, not to take anything away from the Winfield Cavaliers, but it was really heartwarming to see all those children out there having fun, the parents all communicating, talking about their kids being out in the sun and enjoying themselves. It's getting back to a sense of normalcy, and I was very happy to see that happen. The third priority, Carol, I have is, there you go, we have Jack Lyburn with stacks and stacks of folders for the Carroll Rebound program, processing the applications. I really want to take this photo and put it up here for everyone to see, to show you how many different applications they have been processing. He's charted out and organized it. He's shown me they have a quality control system. Special recognition goes out to Paige Sutherland, also Denise and Brian in the office. It's a lot of work bringing in all those applications and processing them. So I want to take this chance to show the behind the scenes of what's going on and give these individuals recognition, because they've been instrumental in helping out our local business community. I'll just wrap it up with a special thanks also to Justin McDonald on our facilities. He gave me a tour of the North Carroll Library up in Commissioner Weaver's district. He gave me the authority to go up there and visit. They're putting a new heat pump ventilation system in. It's nice to go out there and see the guys in the field doing the work and see what's going on behind the scenes. And I want to express my appreciation to Mr. McDonald and all the people in facilities that maintain all those buildings. As I always say, you walk into a county building, you just take it for granted that the temperature is what it is and you feel comfortable, but there's a lot of hardworking men and women out there to make that possible. So thank you very much.
All right, thank you, Commissioner Boucher. I'm going to go next, because when I'm done, I'm just going to hand it back to Commissioner Wentz, because he does such a fantastic job leading this board. Isn't that what you told me to say? Anyway, okay. A couple of things. This past week, I had a chance to go visit some schools, talk to some teachers, maintenance workers, nurses, administrators, basically everyone at the school I talked to at one point or another at various schools. And I appreciate hearing from them and appreciate them being very, very frank and honest with me about what they were saying. And I tried to relay those sentiments to the Board of Education last night. If you saw the meeting last night or the meeting last week as well, and if you haven't, maybe you should go watch those meetings. That's all I'll say about them. They're worth watching if you want to know what's going on with the schools and how they're moving forward. I also want to echo Commissioner Weaver's comments about the Career and Tech Center, the expansion there, which we were all at yesterday. It's something that's really, really worthwhile because we're so many kids on a waiting list to try to get into those programs over there. And now it's going to be expanded, and hopefully we'll be able to take care of all the students in Carroll County that want to go to Career and Tech. And that was really, really good. Again, as Commissioner Wance and Weaver did mention, it was the last board that put that on the agenda basically and set the money aside. If I'm not mistaken, and I could be, I think it was actually Commissioner Howard who made the motion and put money aside for that center. Of course, we all agreed to it. I think he just jumped on it first and, before we could. But anyway, I appreciate Commissioner Howard for doing that. The COVID cases in Carroll County have reached over 2,000. It's a milestone. It's not something that we should be happy with, but it is something that has happened. Again, like Commissioner Rothstein said, masks, social distancing, hand washing, you still need to keep vigilant with it. And I know it's getting old, and believe me, it is, but it has to be done. And that's all I have. I turn it back to Commissioner Wance.
All right. Good morning, everybody. Thanks, Dennis. And while we're on that career tech subject, again, we can't say it enough. That project has been a long time coming, and I truly meant what I said yesterday. It was made easier on the 60th Board of Commissioners when you have two professional teachers as commissioners on there. So again, a shout out both to you, Dennis and Dick, for your expertise in helping lead us through the weeds of making sure that project came to fruition. So that was a great opportunity. And yeah, Dick, we all look forward to cutting the ribbon to let everybody in the front door of that place when it's done. So little personal connection for me. A shout out to my dad, Jim Wance. Dad was one of the first drafting instructors there at the Career Tech Center. So it just, I remember running around that building as a little kid, pretending to help him set up his classroom. I don't think I did anything but run around the building. But anyway, a shout out to everybody over there. It was a great event yesterday, and we very much look forward to that when we can cut the ribbon on that. Dick, you mentioned about voting. I want to give a shout out to our local Board of Elections here. You hear all the rhetoric about the voting by mail, which is, apparently just the worst thing since, I don't know, the Civil War or something. Our local Board of Elections has done an awesome job here of providing the opportunity for folks to vote very easily. They have 3 drop boxes set up now. They've been working hard over there. So to Katie Berry and her crew, to all the citizens of Carroll, don't listen to the rhetoric. It's very easy to vote here in Carroll. Go vote. We had a question come up yesterday, and I want to give a shout out to our municipalities in reference to Halloween. All 8 of our municipalities made the decision that they thought it was a good thing to go forward with it. And we had a little news press thing here yesterday about that. Reminder, there are safe ways in which to do Halloween. And, there's some novel ideas out there. I think we all saw the candy tube where you slide the candy down the tube, put the candy out in prepared pre-bags. There are things that you can do to make it safe. We've got to keep making these things safe, folks. I said yesterday, the citizens here in Carroll have really come through, and our numbers are, while they're up, and Ed will get to this. This sounds crazy, but they're up, but yet they're down. So, and it's a result of everybody doing what is right, and that is wearing a mask. I don't understand what the big deal is about wearing a mask for those that still don't do it. I don't get it. Um, I'll just leave it at that. I'm not going to get on that sermon, but you know, we're only the best place. We're only in the place we are because we're doing the right thing, and so are all the citizens in Carroll. Thank you all very much for continuing to be vigilant. This is Breast Cancer Awareness Month. With everything that's going on, we kind of forgot to mention that, and I want to bring that up. I think you'd be hard pressed to find someone that has not been touched by breast cancer. We have a lot of folks that are on the front lines of that as well. We can't forget, even though we're in this pandemic, that there are people working hard for cures for cancer, and give a shout out to all of them. So my family's been personally touched by breast cancer. I am a huge supporter of everything that goes on this month, and you will see me in pink this month to honor those that have either or that are either working hard or doing or have survived, and just we've got to remember that. The last thing I have for Priority Carroll, a shout out to a local Westminster guy. Art Riley is the president of Kiwanis International. That's amazing. There's Art. Can you see Art? There's Art. Art Riley, ladies and gentlemen, Art Riley. It's a challenging path to get to be a president of an international organization. The Kiwanis do amazing work all across this country and all across the world. And to have the international president from Westminster is a huge undertaking. And I want to say congratulations to Art. He is on the Kiwanis magazine this month. I'm planning on bringing Art on here in Priority Carroll as soon as we can make it work out with the schedule. But if you pass Art Riley on the street, Art will be in a mask. You'll still be able to see him. Congratulate Art. Good stuff. And nice jacket, Rothstein. Nicely done.
You know, I may not have a top hat, but at least I have a jacket.
Well done. Nice pink.
Hey, absolutely right. And you know, you're absolutely right about breast cancer awareness. We all got to continue to share that. You know, in doing the right thing. So that was a good shout out.
Okay. Before we get into all things COVID, County Administrator Wyndham will be hearing from you when we get to the relief fund. But do you have anything for Priority Carroll that we may have forgotten?
We received a very nice letter from a resident down in the Eldersburg area about several of our Piney Run staff members. I don't have it in front of me, unfortunately, at the moment. I should have printed it and had it for me. But maybe Commissioner Rothstein can get it real fast.
Yeah.
We have a tremendous number of excellent staff, and it is so nice when we get a compliment from residents out in the community. It's so easy for people, especially today, it seems like everyone wants to complain. So it's so nice when people take the time and give a compliment. It really was very nice to receive that this week.
Okay. Yeah, I was trying to find that, Roberta, so we could give a shout out to those folks, but I can't find it. If we find it, we'll give a shout out here to them.
I'll get it before the end, and we'll deal with it.
Okay. All right, very good. Okay, anything else for Priority Carroll? Anybody? Okay, with that being said, let's roll into our agenda here. And as we always do, we get an update on any state directives that we've received or any updates from anyone on COVID and where we are with that. We do have to discuss extending our state of emergency today. But before we do that, I want to set the stage here. So I'm going to bring Ed Singer on.
Morning, Commissioners.
Ed, good morning. And we're going to start with you this morning and get the latest statistics whatever you have, and then we'll go into our discussions. So Ed, good morning.
Good morning. I just, before I get started, I just want to thank the commissioners for your continued support as this is, you know, COVID, this whole COVID response thing has been a very divisive issue, and you know, continuing to do the right things, wearing masks and whatnot that are inconvenient to some people in the public and whatnot. It's greatly appreciated that most everybody in our community has been supportive. I know there are a lot of folks who are struggling with some of the things and some of the restrictions that have been in place, and it's just it's been a hard thing for all of us to work through, and just appreciate the support of you all as a Board of Commissioners and the support of people in the community and doing the right things. I actually think that what I've seen around the state, that we're probably going to be one of the first school systems to be going back with the number of kids in person that we're going to have. And you know, while our numbers aren't where I would have been happiest with them to be, they're probably better than just about anywhere else in the state, with maybe the exception of out in far western Maryland. So that said, our community cases, I was hoping, since we hit this peak of 88 that we're back on August 30th, that we would continue to see a downward trend in our community cases. But last week we ticked up to 63. I think we're pretty much, as of yesterday, we were in the mid 30s as far as number of cases this week. So probably going to be fairly consistent with what we saw last week. And I can't really tell you why we've seen this increase in cases. I can tell you anecdotally that the people that we're seeing at the test center, when colleges were going back and whatnot, we were seeing a lot of asymptomatic people being tested at our drive-through test center. And I want to give a shout out to the Ag Center, because they've been great in supporting us, and that's been a perfect location. And everybody's worried as we go into the winter about where their testing sites are going to be, with the VEEP centers needing to get back operational and not being good for the winter elements, that I think we're going to be right where we were, and continuing to operate out of the Ag Center. So it's been a great location for us, but we're seeing a lot more people who are actually symptomatic showing up to be tested, and our numbers that are coming back positive at the Ag Center seem to be higher than what they have been. This is just our 14-day rolling average that I've shared with you all on a weekly basis. And then the other thing that I wanted to start sharing with you is, you know, we've and I'm not sure, I just want to make you aware that there are these things that we're calling probable cases. And we talked last week about the difference between PCR tests and rapid tests that are antigen-based tests. And these are what the state has considered probable cases that are not reported in our regular numbers, our numbers of confirmed cases. These are people who have had a rapid test and they were symptomatic, but they're not considered confirmed because they haven't had a follow-up PCR test. And I do think these numbers could be significant, especially if we start seeing a lot more people getting rapid tests and not getting follow-up PCR tests. Right now, it doesn't seem to be a huge issue, but there are about 70 cases that we've had in Carroll County that aren't counting into our data because of the type of tests that they had done for their diagnosis.
I have a question on that. How
Sure.
come it's a rapid test and they're showing that it's positive, there's not a follow-up test to confirm it? Because it seemed to me
Well, I
that
mean, that's up
in
to
the past
the-
week, you're only looking at 7 people, and you know, you don't have the full range of people coming in for the test, but it is a probable test. And my guess is that when they test positive here, they're isolating all the other stuff. So why not just have the regular test given after a confirmed case from the rapid testing to be sure?
So a lot of the clinicians now are doing both the rapid and the PCR test, because they have to wait a day or so for the PCR test to come back. Frankly, some of the folks that go and get a rapid test, they feel sick, they know they're sick, and the rapid test kind of confirms that for them, and they don't want to go through the process of having another specimen collected. So it's I think this is an individual thing between somebody's provider and that individual. And a lot of these are being done at the urgent cares, and it depends on, if I show up at an urgent care and I have a rapid test and they don't have a PCR test to offer me, to go to another location to get a test is inconvenient for people, especially if they're feeling sick. So
Right.
I don't know that I fault people for necessarily.
Then why don't we just count them as a positive then? Because if they're
This-
showing
this is-
symptoms, they've had a rapid test, the rapid test says they have COVID, why make it probable? Why isn't it, yes, this is COVID?
So we're
I don't
trying to
get
be
it.
consistent. We're trying to be consistent. And I actually had this come up. We actually have one COVID death that happened in Carroll County that's not considered to be a confirmed death, but we're trying to be consistent. This is based on what the CDC's definition is and Maryland Department of Health is following as far as their definition. I think we need to keep these separated out. And I think that it's important to show you this data, but the way that CDC and the Department of Health are counting these cases, I think it's important for us to kind of keep them separate so that it doesn't confuse people about what the numbers are that we're counting. And I understand we could put together a chart that shows the total number of cases if you guys would like to see that. But I do think that when we're putting our data together, I do want to be consistent with the CDC definition and what Maryland Department of Health is using. And we're just making this additional information available so the public and you as Board of Commissioners are aware of it. So if you'd like to see this, we can put together a combined report that shows our total number of probable and confirmed cases together if you want to see the total case count.
So is that why there's a difference, Ed, to follow up on Dennis's question? We're always seeing the difference in the CDC or the health department statistics versus John Hopkins statistics. Why are we seeing such differences here? That's my first question. And my second question is, if you go back a slide to show that we had 66 cases last week, or the before that, or 63, I thought there was a metrics that we set to include those that are making decisions with our Carroll County Public Schools. That was at one point it was 30 something, and then they said, well, we'll go up to 40. Well, now it's 63. So we're not paying attention to metrics anymore either.
Commissioner, it's one of those things where I think and that's something you'd have to discuss with your Board of Education members. I told them that I'd be comfortable where we were with a moderate level of risk. I can't tell them when we would ever get to a moderate level of risk. And ultimately, I think them in their decision-making process and deciding on how important it is to get back to school have to compare what their mission is and how important that mission is versus where we are and the level of risk that they're willing to take. According to CDC, we're at a risk where there's a higher we're at a level where there's a higher risk of transmission in schools. Are we ever going to get to that moderate level of risk before there's a vaccine and we kind of are in the waning days of this pandemic? I don't know. I was kind of hoping, we were moving, trending towards that as we were coming down from the 88 to the 44, and 42 gets you to where the CDC guidance is as far as being a moderate risk of transmission in schools. But I can't tell you when we're going to get there. And I think the Board of Education felt that even with a higher risk of transmission, according to CDC metrics, that they felt like we needed to get kids back in school, and ultimately that's their decision to make.
Well, I don't want to cut anybody off, but just to jump on what Commissioner Wance just said, because I'm the one that sits on the Board of Ed as a commissioner, non-voting. But I think it was last week where I said, our original number was 35, which you came up with, Ed, which makes sense. And then CDC came out with the number would be 42 per week, basically. And okay, so they lowered the bar, so it's easier to jump over. And we still haven't reached that. But even with numbers rising, we're going to go back to school regardless. And I pointed this out, and like you said, it's up to them to make that decision. They're a separately elected board, and they can make that decision. But it seems to go against the metrics that were set up originally, and it makes no difference. It's frustrating from this side, because the last thing I want is a tremendous explosion when the kids get together. So And I'm not saying it will happen, but I think the possibility is pretty high. And I'll leave it at that.
And we're not going to know until they go back. And it's my biggest concern was is we're trying to force opening sports and opening and people, nobody likes to hear this, but every time we open something else up, it causes us to have an increase in cases, and it's harder for us to manage as a health department. I think it's going to be a struggle for us, and we're going to support them as best we can in contact tracing and trying to manage keeping schools open. I know the superintendent's going to struggle with staffing, and if they wound up with multiple teachers out sick or in quarantine, that's going to be tough on them. And this is not going to be an easy ask from any part of this situation. And we're going to see where it goes. But ultimately, I think it's going to be it's going to be an extremely hard lift for the health department and the school system staff to try to manage this. And we're going to have to see what it looks like. I'm uncomfortable with where we are, but it's ultimately not my decision to reopen, and we're going to support the decision that the school system's made as best we can.
Okay, I appreciate that answer, Ed. My question was to try to see what the emphasis is still being placed on these numbers and the metrics that are being put forth. And there's always a difference in confusion because on the local news, you'll see the health department statistics and you'll see Johns Hopkins statistics, and they're always way off.
And I didn't speak to that, Commissioner. And what I'll tell you, the big difference there is and I'll tell you quite frankly how it is we're testing the residents and all the staff in these nursing facilities over and over and over again. And Hopkins has one interpretation of how the calculation should be done, and they don't include those people who are being repeatedly tested because they feel like we should only be counting people once, and the state believes that we should count every test that's done. So the reason that those numbers are so different is if we have 2,500 tests that are done in nursing homes and they're almost all negative, that's what the state's factoring that into their positivity rate, and Hopkins is not. So it's a matter of whether you're including people who've been tested multiple times or not. And Hopkins it's got to do with the definition of surveillance testing versus, and I had this on a slide before, and I'm trying to remember what the term is. It was surveillance testing versus, I can't remember what the term is right now, but the state and Hopkins disagree over what that is. Okay. And ultimately, I've been sharing both of those numbers with the Board of Education because I think it is important to consider kind of both of those things that are out there.
Okay, I appreciate that. I just don't want to get into a place where there's so much confusion over statistics that no one knows where it's coming from next. And as we get deeper into this pandemic and realize the fact that we're nowhere near out of it yet, confusion is going to lead to miscommunication. And man, we just do not need that at this stage of this pandemic. So that was my emphasis on this line of questioning.
And we're trying to be as transparent as we can and share as much information as we can. We've got all kinds of data out on our website, and I know a lot of people have been looking at that. And I'll give kudos to the paper. They're doing a daily report and trying to keep people up to date as to where things are happening. We don't always agree on everything, but it's nice that they're keeping a focus on this and keeping people in Carroll County informed. And again, that same data is available on our website. And I know a lot of people on the Board of Ed have been tracking it there and whatnot. I think, I think there's just I guess I'll just share an opinion. I think there's a level of frustration in the community that people want schools reopened, and the Board of Ed is feeling a lot of pressure, regardless of what the numbers are, to get that done. And the governor and the superintendent of schools have kind of been pushing the local boards and whatnot to do this. And I think that we're really going to be the first one, as I would put it, to pull the Band-Aid off and see what happens. And I'm hoping for, we can always fear for the best, try to plan as best we can and hope that the worst doesn't happen. And we've got a lot of mitigation measures that the school system's planning to put in place. And I know Commissioner Frazier expressed some concern last night that it hasn't all been communicated to the teachers, but I think they're bringing them back into the classroom next week and trying to make sure that everybody's aware of what the plans are. They have all the mitigation measures that CDC has put out there planned to be put in place when we start back to school on the 19th. So we're going to have to do the best we can to support the school system. And we're not in an ideal place as far as I'm concerned with community transmission, but I also understand the frustration of some of the parents that are out there. And there's, regardless of what decisions made, there are going to be quite a few people who are going to be unhappy one way or the other. I guess this chart, this is one that I like sharing because it is important to notice that we haven't had a community death since August, and our facility deaths are very, very low at this point in time. And I'm not sure. I keep trying to figure out whether this is because we know how to manage this better, or we're just managing the control of infection better, or what the reason is that we're having fewer deaths. I know we've got remdesivir out there now, which is an antiviral that was used with the president. It's been used very successfully by our hospital in treating our patients that are that are most at risk of potentially having negative outcomes and potentially dying from this disease. So I think that's become more and more available for use. So it's good news that we're not seeing as many people dying from this. That doesn't mean that we can be complacent. And I guess it scares me when I say, hey, there's some good news about this, that people want to become complacent. But, there's still people who wind up hospitalized, and there's still people who wind up with long-term impacts of this disease, even if we don't see as many people dying now as we did early in the pandemic. So I appreciate the commissioners, as you guys go through your priority, Carol, constantly emphasizing that we're in this for the long haul. And we've got a while more we're going to be dealing with this. And while I share some good news, it's important to know that doesn't mean we can stop doing the things that we're doing to mitigate the effects of this pandemic. There was a little uptick in ICU bed usage, and I talked to Garrett about this. I was a little concerned because we had 4 days in a row where we were over 10 ICU beds. Only a small portion of those were really COVID related, and he didn't feel like it was putting an extreme strain on the hospital. They did see an uptick in people that were under investigation for COVID, and the number of positives that were in the hospital early this week. That's kind of waned now, and as Garrett put it, things are much better. But we did see about a 3 or 4 day period where there was a little more COVID activity on the hospital level than we had seen in previous weeks. And then, as always, I share this community case by age group and week, and I can't tell you why, but for some reason, the 45s to the 64 age group this week just seems to be where our highest number of cases is, where we had been seeing a lot in the 18 to 29-year-old age group, and we're still seeing, a number of cases in this under 18 age group. I kind of keep looking at that because these are going to be the ones that are in school quite often, and we're seeing 5 or 6 cases. And if we wind up with 5 or 6 cases that are actually in school, how many people they have those cases have close contact with are going to have to do with how many people we have to quarantine, and that's my biggest concern with school reopening, is how many people we're going to have to potentially quarantine if we have cases each week. And if one person has close contact with 2 or 3 people, that's only 2 or 3 people we have to quarantine. But if we wind up not following the rules very well, and they have close contact with 8 or 10 people, then that's that many people times however many cases we have that week that have to go home for 14 days and can't come back to school until after their quarantine period's up. So that number, while 5 or 6 cases in that under 18 age group may seem like a small number, if you wind up multiplying that by 10 or 15, that could be a lot of kids that can't go to school. So we're going to have to see how this goes. And then just sharing the hospitalization and deaths by age group that I've been sharing with you on a weekly basis. really not much different here than what I reported last week. And that's the end of the data that I have to share with you, and I'd be glad to talk about any questions that you might have at this point.
I have a question for you, Ed. Quick question, quick answer is what I'm hoping for. In the schools, since you talk about it, have a student that comes in and tests or has the symptoms and you're looking to quarantine that particular student. The students that are sitting around that student that are 6 feet apart and they all have masks on because now they're following the protocols and so forth. Are you looking to quarantine them as well? Is that your recommendation, or are they okay and if they don't show any symptoms? Because they're 6 feet apart, they do have masks. I'm assuming that the student that was showing symptoms has a mask on as well.
Yeah, the biggest problem we have is we can't get 6 feet between every desk in every classroom. And so there are going to be some kids that are less than 6 feet apart. If they're more than 6 feet apart, they don't need to be in quarantine. The definition is if you've been in close contact, less than 6 feet for more than 15 minutes, then you need to be quarantined. And the thing that we're trying to do is make sure the desks are arranged so that fewest number of people have close contact with each other as possible. So there are going to be some people that need to be quarantined because, you know, if the person directly in front of you or behind you is less than 6 feet away, you may be in that close contact situation. But we're not going to be quarantining entire classrooms. We're following the CDC definition of what a close contact is, and those would be the people we would be considering quarantining. And you know, even on the buses, there's no way we can get 6 feet between everybody on the bus. So there's going to be some issues on buses and some issues in classrooms that we're not going to be able to get 6 feet everywhere. And the state guidance and the CDC guidance recognizes that and says to get 6 feet as much as possible. So that's kind of where we are.
Hey, Ed, couple quick things. One is the weather's starting to get colder. You know, there's some discussions and comments about, you know, people are going to be moving inside and it could be more dangerous with this pandemic. You gave a good snapshot, excuse me, of where we've been, where we are today, but the concern is, okay, where are we going? You know, the rest of October into November and follow on. So if you can talk a little bit about that, then the second is, can you give a reason why people would not be wearing masks? And, you know, clearly share the value of the mask and why people would not be wearing masks at this point. So, thanks.
Yeah, Commissioner, and I think there are two reasons that people don't want to wear masks and don't want to wear them properly. Is one is that they're uncomfortable, and I'm sorry, but there's first of all, let's start with why you should wear a mask. And there are plenty of, there was question about this up front about whether masks were helpful or not. I think there's plenty of scientific data out there. If you go and look at it now, we know we've learned a lot about this disease, and we know that it's primarily spread by droplets. There's still a lot of concern that people have about potentially getting it off the surfaces and things like that. And I think that there are very few documented cases where somebody's caught the disease by picking it up off of the surface. And that's not to say that we shouldn't wash our hands and keep our surfaces clean and all that type of thing. But this disease really spreads by aerosolized droplets. And there have been a lot of studies that have shown that these cloth face masks are extremely effective in limiting the spread of those droplets. And you know, there's one that I saw that actually does a visualized type of thing where you can see somebody with a mask on and a mask off as how far what's coming out of their mouth when they're talking or just breathing changes when somebody's wearing a cloth face covering. The other part of this is just, I think there are a lot of people out there that are misinformed and I've actually seen information that talks about how this increases your carbon dioxide levels and things of that nature. And it's really, I mean, if you look at the scientific studies, there's really no risk to wearing a mask. I mean, surgeons have been doing this for years where they, you know, you'd think you'd see a high rate of negative health outcomes in all of our surgeons and whatnot that wear masks for 8, 10, 12 hours at a time when they're doing surgeries. It's not that there's I think there's just a false belief out there that there's some negative consequences to wearing masks. And yes, there's studies out there that say there's a high level of bacteria that'll wind up in a mask, but that's the bacteria that you're trying to block transmitting to other people. It's coming out of your own body. We're all human beings, and we all have our own bacteria and virus secretions that we breathe in, and it's our own bacteria and whatnot that are going into the mask, and that's the whole purpose of wearing the mask to start with, is to keep from transmitting that to other people. So there's nothing unhealthy about wearing a mask. I think there's some false sense out there that it is. And the last thing I guess I'd add is there's just a political push out there that some people think that this is an invasion on their freedom. And I really think, that we as a society have a responsibility, social responsibility, to take care of each other. And, while it may not be comfortable for us to wear a mask and we might not like it, we've got a responsibility to take care of each other and not make each other sick. It's the same thing of, if you're sick, you shouldn't be coming to work, even though, you might think it's the right thing to come to work. You're just going to potentially make other people sick and lower productivity because then your other coworkers can't come to work because they're sick. And it's, I look at it the same way with wearing a mask. We're protecting each other from becoming infected. It helps us be more productive as a society if other people aren't sick. So I think there's some false information out there. I think there's also concerns about how this infringes on people's freedom. And then there's the thought that it's just uncomfortable. And I think we have to make this little sacrifice to try to help us all get through this pandemic. So I hope that answers your question. And if you've got anything further, I'd be glad to try to address.
It sure did. You captured it very well. Now, about the changing weather and the upcoming months, is there more risk that you see? I mean, it sounds like there is from everything, I've been reading in the news, but.
Yep. I mean, since the beginning of this pandemic, everybody's been saying, including the governor, that it's safer to do things outside. And, it's going to be cold, it's going to be uncomfortable. And I know some of the restaurants are looking at putting in space heaters and things like that to try to extend their outdoor dining as much as they can. And quite frankly, everybody's got to be comfortable with their own level of risk. And I know, some people are comfortable with eating indoors right now. I try to avoid that at all costs. I haven't eaten in a restaurant since March, and other than outdoor dining. And I look for those restaurants that have made that effort and try to go to those places. But as the weather gets cold, it's going to get to the point we've talked about this with nursing home visits and whatnot. It's easy right now. We're encouraging people to do outdoor visits in nursing homes. But as the weather gets colder, that's not going to be as possible. There's only so much cold that people can tolerate. And we can't do much about the weather turning colder. We just need to make sure that we try to take our precautions as best we can and stay 6 feet apart as much as we can indoors. And if you can do things outdoors and with less crowds of people, that's going to lower the amount of risk. And we may see our cases tick up as people were kind of forced indoors by the weather. But we all just need to kind of at least have that sense about us as to what our levels of risks are with larger crowds. Try to avoid those. There's still a lot of restrictions in place for indoor activities. But the larger the crowd and the more people you're around and the more people you're exposed to, the higher risk of transmitting the disease, getting transmitted to you, and then ultimately you can pass it along to somebody else. And I know this is hard. I'm a very social person, and I like to be around other people, but we've had to limit that, and it's difficult for everybody. And just appreciate people trying to do their part as best they can.
Mr. Singer, thanks for your service. I think all of us ultimately as public servants have the objective to save lives. And I think the chart showing the fatality rates show that you have produced some really good results. But I'm curious, when I look at the charts of the fatality rates laid over by the infection rates, they don't correlate. You'd think that with the uptick in infection, there should be an uptick in fatalities, and that's not happening. Is that because of the treatment and the technology has changed since the beginning when we've seen that big bell curve? What do you attribute the disproportionate disconnection between the fatalities and the infection rates? What do you attribute that to?
Well, and Commissioner, I am speculating here to some extent. One is we're certainly not seeing as many cases in nursing facilities where we have a very vulnerable population, and the age of people that are contracting the disease is not as high as what it was early in the pandemic. So those risk factors have gone down somewhat. And I did say earlier that I think that, our ability to recognize and treat this disease effectively, we've learned somewhat, and we have the antiviral drugs that are out there and some other things that we've learned how to better treat this disease. So I think it's a combination of things where the people who are getting infected and getting sick aren't as vulnerable a population as they were before, and that we do know how to better treat this disease. And again, I like the fact that we're seeing less deaths, but that's not to say that we're not seeing negative outcomes still, and people who have been hospitalized and potentially having long-term respiratory impacts, and there's also some cardiac impacts that folks are concerned about from this disease. So I certainly don't want to minimize any of that, but I do think we're learning to deal with it better, and I do think that the population that's getting sick at this point is able are less vulnerable than the folks that were getting sick earlier in this pandemic.
Thank you. And the latest numbers on the fatalities are 147 fatalities and 130 of them in the congregate living facilities. Now that we have the contact tracing, does contact tracing take place upon the individuals that are in the congregate living facilities? And what information have we obtained from that? How are these people in these facilities contracting the disease? Because I don't believe any of them are out in the public without masks. I believe they're contained in the facility. So what have we learned with contract tracing and fatalities?
Well, I mean, if you're talking about how folks in nursing homes you got staff that come and go every day. And obviously if you didn't have anybody going in or out of the facility, the risk of infection there would be very small. There are two things that happen in long-term care facilities where we wind up seeing infections. And we've been doing I think the facilities have been doing a much better job in infection control since this thing got started. They're learning as well. But the ways that generally getting into these facilities is a staff member becomes sick, and that's why they're trying to test, much like the NFL is trying to test their players on a regular basis to keep from spreading it throughout the football league. The nursing homes are being required to test their staff on a regular basis so we can identify people and keep them from having contact with patients. But generally, the way this has gotten into nursing homes is staff have brought it in. We've had doctors bring it in that go from nursing home to nursing home, and it's really difficult when you have people working at multiple facilities. And then the other way that it gets in there is sometimes patients are taken out because they need treatment at an outpatient facility or at a hospital, and sometimes they wind up getting it there and bringing it back in some cases. So, or if they come in from another facility where they might have been infected. So it's generally, I think, the majority of the cases we're seeing in long-term care facilities are probably coming from staff of some sort bringing it in, but it can also come from residents that have been either out for some type of treatment or coming in from another facility. And there are things that are being done to try to mitigate that by quarantining new patients and things of that nature. But I hope does that answer your question?
In some way. Do the facilities have a very stringent face mask policy in place to protect the residents?
Absolutely. I mean, they've been the most locked down group of people that you would. The thing that's really been a struggle is we've had a lot of folks concerned about the amount of lockdown that, from March until just up to a week or so ago, it was virtually impossible to go visit somebody in a nursing home. Now, the Medicaid and the state have both loosened the requirements for visitation in nursing homes, and those folks have been very, very tightly regulated since very early on in this pandemic, and there are people who essentially hadn't seen their loved ones since March up until just recently within the last few weeks. So it's not only are they wearing face masks as is required so that we're not transmitting it from one person to another, they're also not having contact with a lot of people on the outside.
Thanks. So it'd be safe to say that the facilities in this county who've been locked down and have the most stringent face mask policies have the highest fatality rates. Is that a fact?
That's true. They're also the most vulnerable type people from a susceptibility of this illness standpoint.
So the people in the public who had the most vulnerable susceptibility will most likely contract this disease with face masks as well. The general population.
I'm not sure what you repeat what your question is.
What I'm saying is, if the people in these facilities who are the most vulnerable, who have the most stringent face mask policies, are contracting and dying of this disease, then wouldn't it be a reasonable estimation that the most vulnerable citizens in our general population who exercise face masks are at the same rate of potentially contracting and dying of the disease as well?
Well, they're not living in congregate living facilities, and they're not having contact with as many folks as we have in a congregate living facilities. I mean, we saw outbreaks in these facilities, and this was early on in the pandemic, and we're not seeing outbreaks in those facilities now. It's well managed. But I think we're talking apples and oranges here, where we're talking about 100 people living in close proximity in many of these nursing facilities, whereas an older person who might be more susceptible living out in the community, a lot of these folks are taking precautions, and they're having people pick up groceries for them so they have less contact with people. They're not going and eating indoors with a lot of people. They're avoiding crowds. So, I mean, there's ways that people that are extremely susceptible in our society that are living not in congregate living facilities are avoiding infection. So I'm not sure.
I'm glad you
how to answer your question.
The point I want to make for people out there in the general population is that if you are susceptible, take the steps and procedures like you just emphasized, limit your exposure, keep the distance. And I just want to emphasize that the face masks aren't fail-safe, that we've seen that with the congregate living facilities. And I don't want senior citizens or people with vulnerability out in the general population to have this false sense of security that putting on masks is going to prevent them from contracting the disease, and that there's other measures that they can take to protect themselves. Like I've constantly emphasized, I don't go into stores anymore. I order online, and I don't have any pre-existing conditions, but I like to lead by example for other people out there that are susceptible to take those extra measures and don't think that just putting a face mask on is going to be the end all to save your life. So your emphasis on those procedures is greatly appreciated. Thank you.
And Commissioner, thanks for that point, because, and I think that people need to realize just because you put a face mask on, that doesn't substitute for trying to keep that 6 foot of distance between people, because it's a combination of things. And we put a whole bunch of mitigation strategies in place to try to make sure that we can get as few people infected as possible. And just because you're using one mitigation strategy doesn't mean that the other ones aren't just as important or more important in potentially limiting the spread of disease. Because just because you have a face mask on doesn't mean you should get into a group of 10 people closely together, because people are still going to potentially transmit the disease to each other. These things just help us reduce the level of risk, and none of it takes the risk down to zero. So I think that's a very good point. And I was having a hard time following your logic at first as to where you were going, but I think that's a very outstanding point. Thanks.
Yeah, well, it's such a controversial issue, and I think all of us feel pressures from different constituencies and directions. So I appreciate you elaborating on that. Thank you very much.
I just want to share something now. And this is the responsibility of wearing a face mask, is not dealing with the susceptibility of living or dying. It's the susceptibility of getting a virus or spreading a virus. And most people that get the virus live and get through, whatever symptoms they may have. Some may be asymptomatic, others may get some symptoms, others may get very severe symptoms. But wearing the mask does not mean that you are susceptible of living or dying. It's all about contracting the virus and spreading the virus. That's where the masks, piece plays into this. And like you said, Ed, it is all our responsibility to wear the mask so we don't spread this virus to those that may be susceptible or those that may get the virus and then spread it to somebody else that may be susceptible. And that goes right back to the discussion we had with the schools. The kids may not be susceptible to getting severe symptoms from this virus, but they could be susceptible of carrying the virus to family members and neighbors in the community. And that I know is part of the risk. So the mask wearing is nothing to do with, the severity of symptoms. It has to do with the spread of this virus. Is that pretty accurate, Ed, or am I off base on that?
Yeah, I agree with you 100%, Commissioner. And the whole point of all the steps that we're taking are to try to limit the spread. And ultimately, we don't want anybody to have negative impact of this virus. So, thanks.
All right, any other questions for Ed? The only statement that I will make is the other factor that we haven't put into this yet is the long-term effects that folks are going to have based upon contracting this disease. I hate to do comparisons here, but I had a lot of brothers and sisters rush into the 9/11 Twin Towers issue, and years later, they're dying at unbelievable rates. So I think it's the same thing or similar with this. We don't know what the long-term effects are going to be, and we're not going to know that for quite some time. So that's another thing to be very concerned about. And I continue to say I'm not making this political. There are people that are a lot smarter than me that went to school to be doctors and healthcare professionals. I didn't. I'm listening to them. Any other questions for Ed? All right. Ed, thank you. We also need to make the decision here. Maybe you want to stick around just a little bit, Ed, in case there's conversation on this.
I'll hang around if there's any questions, but thanks, commissioners, and I'll stay on the call, and you all can have your discussion.
Okay. We haven't gotten any other directives from the state. We do need to make the decision today to extend our state of emergency. I'm going to continue to say that I think it's important that we do so. I think there are a lot of federal and state grants out there for reimbursement that could be in jeopardy if we don't. There could be a tiered effect as well, that jurisdictions that are not in state of emergencies have first dibs at those funds, and those that aren't wouldn't be. So that's one thing. And two, the biggest thing is the fact that we cannot become complacent here, and we've got to continue to do everything that we can to have the diligence to make sure we get through this. So I'm in the mindset that I'm not even sure this is up for debate. In my mind, that I think we should extend this for another 30 days. And I'll put that motion on the table, and I'll leave it there for debate.
I'd like to hear from County Attorney Burke on this, because he sent us all a printout on the local state of emergency. So I'd like to see some legal discussion on this. I'm of the mindset that we need to get back to a sense of normalcy. And as long as the state of emergency is in place, we've lost that sense of normalcy. But I've also been informed by Mr. Burke that even if we lifted our local state of emergency, we can't do anything outside of what the governor gives us the authority to do. Mr. Burke, could you elaborate on those technicalities?
Yes, that's correct. The local state of emergency, I'm going to use the word, is largely symbolic. It is a declaration of the county commissioners that in Carroll County, there's an emergency. And all that does is trigger the implementation of our emergency management plan, and empowers the county commissioners to make grants and transfers pursuant to that plan to the citizens. And that's it. And as Commissioner Boucher said, repealing the local the local state of emergency does not absolve you from following all the governor's executive orders that have been issued in this matter.
Thank you, Mr. Burke, because there seems to be a sense of confusion with some constituents out there, not only mine, but my colleagues, that if we lift this local state of emergency, we have the authority to override the things the governor has issued, which we don't. And even though I might disagree politically and scientifically with some of the policies, under the present state of emergency, even if we lifted it, it does not give us the authority to change things. However, on a political sense, if we did lift the state of emergency, it does go towards presenting a sense of normalcy to our constituents and our economy. And after looking at the numbers on the fatalities, and we've flattened this curve and the fatalities are so low, it defies my logic why we stay in this state of emergency if our objective is to save lives, and we have saved lives. And I don't see in the foreseeable future any uptick in those fatalities because as we just observed in the charts, that there seems to be absolutely no correlation between the infection rates and the fatality rates. So I'd like for us to get out of this state of emergency locally as an example of leadership and bring normalcy to our economy and our county. I want our economy to thrive. And if we're not seeing fatalities by opening up, I have to question, why are we in a state of emergency? And previously I talked about receiving a grant funding, and that's helpful. But I am very, very fearful on the long term of the financial implications of this state of emergency. Sure, we can get some largesse and grant money from the federal government, but is that truly going to backfill the damage we do to our economy and our receivables in the long term? And I don't think it will. I think it sets a bad example for the population that we, the government as an entity, get funds, and eventually those funds will run out. Our federal government, our state government, which is running the deficits, cannot keep printing money and giving us things to keep us afloat. Like any other adult child, eventually we got to move out on our own and sustain ourselves. And that means we have to have an open, thriving economy. Because what's going to happen 6 months down the road when we're still in a state of emergency in the exact same position we're in, and the government finally says, look, we can't keep printing money and sustain you, that you're going to have to open up your economy and support yourselves. So I think inevitably to keep renewing these states of emergencies is constantly kicking a can down the road to what? Eventually to hope that one day a vaccine is created. And we all know the percentage of vaccines have success and lack of success. I just don't think waiting until a vaccine comes about is the golden thing that's going to save us. I think it's endemic upon us to start opening our economy up and getting back to normalcy now. So I would like to end the local state of emergency mainly as a political statement towards the governor that we have good numbers and our fatalities are down, and that we as responsible adults in our county can operate our economy and maintain the health and safety of our citizens. So I'd like to get out of this state of emergency and be the leader in the state to show other jurisdictions they can do the same thing, because ultimately our responsibility is public safety and saving lives. And I think we've done that so far. And it was just shown a minute ago that there's absolutely no correlation between the face mask policies and the fatalities, because where the lockdowns are the strongest and the face mask policies are the strongest, or where we have the highest fatalities. So there's no logical correlation between the two. And even if we do see infections go up, I think it's going to be okay for us as long as you're in a lower age bracket, you're not in a high risk zone. So for political reasons and economic reasons on the long-term safety and well-being of our economy, I'd like for us to get out of this state of emergency.
Let me add on a couple of things, because Commissioner Boucher, I agree with a lot of what you shared. And I agree with the intent of what I believe you're trying to get to. You use the words economy, safety, security. Now, you and I have had the conversations. I don't use the word constituents because it doesn't make too much sense to me. It's about community and neighbors and family and friends. I don't think of it as politics, especially at the county. I think of it as resource management and focused on safety, security, and promoting quality of life for our community and our county. And I think we're doing that. So with all those things in mind, I don't believe that Carroll County needs to make a statement to our governor, who I believe is trying with his administration to build the economy, continue a safe and secure environment. There are things that I may not agree with, that has gone on, but that's regardless. And as Mr. Burke shared, that it sounds like it's symbolic in a sense. And for me, there's no reason not to continue if we're focused on what I believe is true, and that is safety, security, economy, quality of life, resource management with the budget. So there's no need to not continue a state of emergency because it's not going to change anything. It's not about constituents. It's not about politics. Like I said, I used to be a special ed teacher, then a soldier, so correlation doesn't really make a whole lot of sense. I know it's a big word, with math, but it's a word I don't use. So I just, am thinking that we should maintain, not status quo. And I know that's where you are stuck because you don't want status quo either, and I don't think any of us do. We should not. We should continue to look forward on how to promote the economy, the quality of life. Look at the resources that we're going to have available to us, especially going into next budget season, which is right around the corner, believe it or not. So I don't want any distractions in doing that. And one of those distractions would be to try to make any sort of statement at this point when there's no need to make a statement. So continuing a state of emergency allows us to keep the emergency protocols and processes in place. It doesn't affect anybody. So, for those reasons, again, I agree with a lot of what you said, but I see the getting to that finish line, it's just a different path. And, but, you're spot on when you talk about quality of life and you talk about the community or, the economy, safety and security. And I don't want to back away from that. So, yeah, Steve, if you made that motion, I will second that motion, and we can continue on this discussion. But we have a motion and a second at this point.
I would like to add to the discussion. Since the state of emergency, and I think you all know how I feel about this because I've been vocal about this. At the beginning, I thought it was necessary. I don't think it's necessary any longer. I really don't. Schools are going back. Recreational activities are going on. A lot of things are moving forward in this county. The state of emergency is just symbolic. There have been no funds attached to being in a state of emergency. There's no indication that there will be any funds attached to being in a state of emergency. So we've been in it for a 5 or 6 months. And at first I thought it was very necessary and we did it. And I thought it was a great thing to help us streamline some stuff. I don't see the need anymore. I really don't. And I already think I know how the vote's going to go, and that's fine. I just want to express my thoughts here because of the way the economy, we're in phase 3 now, phase 3A, but we're still in phase 3. Things are moving forward. It's just a symbolic state of emergency. Why keep it? And there's, why do away with it? I can go back and forth on that all day. I just don't think it's necessary. I really don't with everything, the way it's moving forward. And I'll stop there.
Okay, if I can just add a little bit here. There's no right or wrong answers in this. We're all going through this pandemic. It started as a 2-week process, and now we're 6 months or more into it. And we don't have the right answers. We don't have the wrong answers, but we're all trying to do the best we can to get through it. I don't see, the state of emergency in our economy. Our economy's coming back. We are working. The schools are coming back. Things are starting to move, I think, in the right direction. Most things. Now, some businesses every business is different, but most businesses, I think, are starting to move in the right direction. What's the rush to take this out, eliminate this? Right now, I'd like to see, schools will be back in 2 weeks and see how they evolve and where we go. The state of emergency, as you said, is symbolic. Really doesn't mean much to us at this point, but yet, is there a rush to get rid of it? It's not going to mean anything. whether we have it or don't, I think we're going to just be a little easier to deal with an issue if it pops up in the next couple of weeks. I'd like to see schools get back. I'd like to see where we are in a couple of weeks before we deal with that one here. And I just don't see the major push. What's it going to do for us?
Well, if I can, I'd like to add that, last month there was a 50% increase in drug overdoses in the county, that there is a psychological impact of this upon our economy and our constituents. There's an increase in anxiety, there's an increase in depression. There's more people dying of drug overdoses in our county right now than COVID-19 patients. And I think there's a direct correlation between our lockdowns, the enforcement of masks, and the psychological impact it's having upon our economy with the increase of alcohol and drug addiction and the overdoses in our economy. I think that we have inflicted a cure that is causing more damage upon our citizenry than its cure.
So then it's your recommendation that we stop everything. Is that correct, Commissioner Boucher? Because you
No.
just said the masks are causing overdoses and the best practices are causing. So you want to stop everything. Is that
What I'm saying
is that where you're going? Because the other thing with you and your little economic comparison, we've got the lowest unemployment rate in the state of Maryland right now. Small businesses are coming back. Restaurants, while they're struggling, are doing a pretty good job. So based on the fact that we're doing well, what is, I assume out of your statements that you just want to stop everything. I guess that goes in line with the fact that you don't wear a mask anywhere.
Let me emphasize that back in June, I attended a rally to open up small businesses, and not one of my colleagues here attended that rally. And one of the reasons was we were told, oh, if businesses open up, there'll be more hospitalizations, more fatalities. The same thing with a Little League rally I attended. None of my colleagues attended that. We were warned the exact same thing. And after those businesses opened and after Little League opened, there was no mass hospitalizations. There was no fatalities attached to it. I just feel that we have policies in place that have no scientific link. And the fact that the congregate living facilities are represent 90% of fatalities and they have the mass is proof that my position is correct on this. And I'm not stating that we need to blow everything open right away. What I'm stating is that this board, in its responsibility, needs to stop staying in the status quo and start developing an exit strategy incrementally to get out of this. Just like the restaurants opening up, just like Little League opening up, there's certain steps that we have to take. And ultimately, it should come down to the individual discretion of citizens as to whether they want to wear a mask or not. If you're in a high-risk category, wear a mask. I'm also a strong advocate of businessmen setting their own policy. If you have a business and you want mandatory masks, you should have it. If you have a business that you want optional, that's your right to choose. Because I don't see any correlation whatsoever in the scientific data we've seen that the increase in the infection rates are resulting in fatalities. It's there in black and white. We just seen it this morning. But incrementally, we need to start figuring out how to get out of this and get back to a normal state of life.
Okay, Eric, again, there are things that you're saying I absolutely agree with. There's a couple of things that I do want to share. One is high-risk individuals wearing masks. That's not where masks will come into play. It's people wearing masks so they do not spread the virus to high-risk individuals. It's all of it, and this is where Mr. Singer shared. It's all our responsibility so we do not spread the virus. It's not that we do not get the virus. It's that we do not spread. That's why it's all our responsibility to wearing the masks so we don't spread it. If you're high risk, like you said, limit your vulnerabilities by going in places and things like that. But wearing the mask is not about somebody who's high risk. It's about spreading it to somebody who can then become vulnerable. So that's the importance of wearing the mask. It's the transmit, not the receive. The rallies, I'm not sure. I know about the one rally you're talking about, but I'm not into rallies, but I will share, and you know this, I'm a huge advocate of small business growth and development, and we have put $3.5 million into that so far, 900,000 from our own coffers and then from the CARE Act. So we as a county have promoted small business growth from day one. And we were in the forefront of that across the state because of Jack and his team's, processes that they put in place, but because of our direction that we allowed him to go. As far as the football and recreational sports, we all got those messages. I was in constant contact with the recreation programs leadership in finding ways to get them going in the right direction. And we finally did. It wasn't about a rally from one group of Westminster, but it was about the whole entire county getting recreation programs back in place where we can allow them to participate. And I know for me, spent a lot of time with the recreation leadership to get them there. So it's, yeah, I understand the point about a rally, but us not attending rallies doesn't mean that we were turning our back to the situation. We, I think as a group, have been very aggressive on both of those fronts. But getting back to that mask, I'm very specific on that. It ain't about receiving the illness and the virus. It's about transmitting it. And that's why it's all our responsibilities. So
I have to say, I think we're getting off topic here because the state of emergency has nothing to do with wearing a mask or social distancing or anything else. It doesn't have anything to do with that. And as far as the rallies go, Commissioner, I don't think you're the only one there at the recreational thing. I think I was there with you as well. By the way.
Yeah, I'm sorry. I spoke, but Dennis was there. My apologies. Dennis was there. He's very much into sports. My sincere apologies.
But this really has having to do with all that. It really doesn't. We're still going to do best practices. I always talk about the numbers and wearing masks almost every single priority care. I talk about that all the time, or maybe not all the time, but most of the time, because I think it's extremely important, but has nothing to do with that. And we could go round and round with this. We have a long agenda. We stated our views on this. I think we should
call the vote.
End the state of emergency, but let's call the vote if that's okay with everybody else.
Yeah, I'm more than ready to do that. And the last thing I will say is being called out for not standing somewhere with a sign and rah-rahing is not the way I roll. I roll by personally connecting to the folks that are directly involved. I'm not a big rally guy. So I've made that quite clear to many groups as well. And I don't know what point that makes. I'm not sure where that was going with that. So don't understand why rally is a huge big deal, because the only thing rallies accomplish is make a point to the folks that are at the rally. So I've heard that you want to call for the vote. So we'll do that. We've got a motion and second to continue for 30 days, our state of emergency. Those in favor of that motion? And opposed? Okay, that's 3-2, and we will be in the state of emergency for another 30 days. Anything else on COVID?
I just want to say, President Wance, thanks for the dialogue, debate. Even though we occasionally disagree, all of us, I think it's so vitally important that this discussion took place, and I'm very happy it took place. So thanks to my colleagues for having this discussion publicly so our constituents can consume it. So thank you very much.
Anything else on COVID? All right, let's get to the relief fund. Roberta.
Good morning, gentlemen. Going to be joined by Debbie Standiford, as always, our wonderful grants manager, and Jack Lyburn. Not a lot changed in the last week with regard to the relief fund and the plan. And the plan is still the same and being implemented as we had originally laid it out. We are about halfway through from the time it was first awarded to us and the time it needs to end and be spent. And so staff is in the process of assessing where we all stand on all the projects, whether it's county directly or our affiliated agencies, towns, et cetera. So we've reached back out to all of the agencies we originally included in the plan and are asking for basically a midterm accounting. We expect to have all that information by the end of next week, and then some recommendations to the board for any adjustments to the plan based on that account for the week of the Thursday, the 22nd, week of the 19th. So unless you have any questions with regard to that, I will turn it over to Jack Lyburn, who will give you a little update on the last week, or possibly last week, of the Carroll Rebound.
Commissioners, good morning. Last week, last Wednesday, we cut off the portal, and you said to extend it another week. We extended it until last night at 5 o'clock. Last week, since we opened it back up, we received 10 businesses, 2 nonprofits, and 12 farms, for a total of 24. So total since last Wednesday. And we did shut it down last night at 5 o'clock. That gives us a total of 535 businesses, 41 nonprofits, and 123 farms. However, we still have 41 businesses, farms, nonprofits, all the total of 41 that we're missing documents on. And that total comes to about $225,000. If all those $225,000 would come in, it would give us still our total about $3.5 million is a good number. So what I'm asking is that you give us, don't open the portal back up, but give us 2 weeks to go back. And we have sent memos, we have sent emails, we have tried to call these 41 people and ask them for missing documents. I'd like to have at least 2 weeks. Keep the portal closed, but go back to these 41 applicants and see if we can clean that up, and then come back to you in 2 weeks with a total. I'd like to give them time to come back with the documents. We've been working with them. 3 of them are tax issues. We had 10 as of last week, and we cleaned up 7 of them. But we still have, like I said, 41 applicants are missing some kind of documents.
I think that sounds very reasonable. I mean, they've already submitted the paperwork. They just don't have it all in. We can certainly wait for them to get all the paperwork in if they intend to do it. I don't see a problem with that.
Is that a motion?
Do we need a motion? We just need to say, yeah, we're okay with this, I think.
You know, Jack, I'm getting tired of complimenting you and your team, but it's you're doing phenomenal. And I am so proud being part of this community and what you've done for small businesses, from, again, what we discussed early on to how you're dealing with the CARES Act funds. Yeah, I agree. If that's your best judgment at this point, recommendation, to, take care of those businesses that have put in, and give you guys the opportunity to take care of them, why not? That makes perfect sense. But again, just thank you for all the work and your team is doing in taking care of these businesses in the county.
Well, this has really been a team sport on this one. Everyone has really stepped up, and our mission is to encourage and promote businesses, our farms, and our nonprofits. And I think we're there with your leadership also. But I mean, some of these documents, you're right, Commissioner Frazier, they might be missing one page of this, but they've done most of the hard part. But I'd like to give them another 2 weeks and not come back with a report with you next week, but in 2 weeks I can give you a final report and tell you. But we're looking somewhere around, if everybody comes in, about that $3.5 million mark. It hasn't changed. So,
Mr. Lyburn, thanks for giving me a tour of the process of how you were processing the applications. I want to reassure people out there, having seen that operation, that there's stringent quality control in place, that this isn't just willy-nilly. There's a checklist, there's a process, there's multiple people reviewing these applications. So I was very much impressed with the process and procedure you have in place. So thank you very much.
Thank you.
I agree, Jack. 700, not quite 700 businesses you hit out here, and it's has to help the economy.
Well, that doesn't include the first round, when we gave out almost $900,000 there. This is the second round, so.
Okay, anything else for Jack?
I have one more comment. It's not COVID related or rebound, but remember, gave you an update last week. We start tomorrow night with stop by from 3 to 7 at the Farm Museum. We have 7 food trucks. Please stop by and take your dinner home or stay out there and eat it. It's going to be a nice night to sit out at the Farm Museum.
There's a commercial for Food Truck Friday at the Farm Museum.
Yes, I think that's important. I think it's good for the citizens. It might be good to get out. It's going to be a nice evening tomorrow night.
That's a lot of F's in that. Food Truck Friday, Farm Museum. Okay.
I like that. Thank you.
All right. Roberta, anything else from your end on this COVID relief funding?
Nope. Everything else is just staying the course.
Okay. All right. Very good. Thank you. We'll move on now. Next on our agenda is approval for purchase of long-term and permanent barrier solutions in our high traffic areas throughout the county office building. And I see Jason Green, our Deputy Director of Works. So Jason, I'll turn it over to you.
Good morning, Commissioners. We're before you this morning to request the Board of Commissioners approve us to utilize the Duron Inc. contract to install these particular, supply and install these particular cubicles in the amount of $28,897 and yes, 2 cents. This work will include adding cubicles and or glass particular structures at a lot of our front desk areas. As you are aware, back when the pandemic started, we initially installed some sneeze guards and some other temporary type measures with plexiglass and the like. This particular project is really to make these permanent solutions for these areas. So be much more professional and also add additional safety features for these particular employees and when visitors are allowed back into the buildings. So with that, I'm glad to answer any questions you may have. Just one other small detail. Some of these will be installed on existing desks. So it is a glass enclosure on the existing desk. And some of them will actually be a cubicle with fabric up to about 50 inches and then glass material above that mark in order to provide this protection.
Okay, questions for Jason?
Hey, Jason, was this a competitive bid?
This was a term contract through Duron, which we use them frequently for furniture and other cubicle supplies in the county office building.
Okay, thanks.
And this is CARES funding, right, Jason? This is not coming out.
This is CARES funding, so there is no, that's correct. It is CARES funding.
Okay. All right. Any other questions for
With
Jason
that,
on
I'll
this
make a
project?
motion. I'm sorry.
Go ahead, Dennis.
All right, with that, I'll make the motion that the Board of Commissioners approve the use of the Duron Incorporated contract to provide cubicle walls in the amount of $28,897.02.
Second. I was waiting on Weaver.
All right, I've got a motion and second. We're experiencing a little bit of technical difficulty too here probably, but we'll get through that. All those in favor of this motion? Unanimous. Thank you, Jason. All right, heat pumps for the North Carroll Library. Who we got on for that?
Where's Mr. McDonald?
There he is. There's Justin.
And he has a nice tie on. Thank you very much.
Justin, good morning.
Morning. How's everybody doing?
Okay, before we get your presentation, I'll turn it over to Maureen in purchasing to give the presentation on the heat pumps. Maureen.
Good morning. Yes, we went and solicited bids to remove, relocate, and replace 2 water source heat pumps at the North Carroll Library. We're requesting your approval to award a contract to Rummel Construction LLC in the amount of $73,966 to complete this work. The cost includes all labor, materials, and equipment, and this is within the budget. And then Justin, I'm sure, can answer your questions.
Morning, Commissioners. We are asking for your approval for the removal and the installation of the 2 water source heat pumps located at the North Carroll Library. These 2 units have been probably in that building since day one, roughly 30 years old. The average life expectancy of these average heat pump units, Commissioners, are roughly 20 years. So we definitely got our money's worth out of these units. The heat pump manufacturer that we're going to be installing is Water Furnace. Water Furnace has a 5-year warranty on the compressor and 1-year warranty on all parts. Rommel Construction, located in Ithaca, Maryland, has been in business installing mechanical equipment for 50 plus years. What questions may you have on this project?
Have we used Rommel Construction before?
We have not, Commissioner. This is the first time Rommel bid for us, hasn't done any work for us. So we did our due diligence and did some background checks on them and made sure the references were all good to go, and followed up on some other emails and their pictures of work that they have performed. And it seems like they are a very well fitted company to perform this work for us.
Right. I mean, the main reason I'm asking is because of the difference in the 2 bids that we've received. But
Exactly. And
if they could do the job, then that's all I need to know.
yeah, and I took notice of that too.
Mr. McGowan, I appreciate you giving me the tour of that facility because it really put it in perspective of how complex and complicated that job is, that the existing units being replaced are up in the ceiling and they got to disassemble them in pieces and feed them down through to take them out of the building. So I think that might be attributable why there's a big price difference between the second quote because of how complex it is. So that price that we're receiving is quite exceptional, being involved in mechanical contract, and that contractors don't be able to go in there and disassemble the old units as tough as it's going to be. I think there's also, you showed me there's a bump out in the floor plan. Could you describe that for everyone as well?
Yeah, so these units are located in a mezzanine, roughly 8 feet above the mechanical room. And my techs need to get up there and lay on their bellies to perform these tasks that we do on these units daily. And what we're proposing is we're going to remove them out of this mezzanine area, which is not really safety. And we're going to put them in a new built mechanical room down on the ground floor. So it's going to be easier to maintain long-term, puts our employees out of the risk of climbing up on a mezzanine and doing some major work up where they don't need to be if they don't have to be.
Thank you for explaining that.
With that, Commissioner Boucher, you have to visit the Finksburg Library too. Between that and North Carroll, you have 2 of the best libraries in the county. But with that, I'd like to move that the Board of Commissioners award a contract to heat pumps for North Carroll Library to Rommel Construction LLC in the amount of $73,966.
Second.
All right. Any other questions? All those in favor? Okay. Thanks, Justin.
Thank you. Have a great day.
Thank you
All
for
right.
the tour.
6-man crew cab, stake body truck. And Mr. Myers and Keith Vogel are on here. Mike, good morning.
Morning, Commissioners. Yeah, we'd like to request your approval to award the purchase of a 6-man crew cab stake body truck to Apple Ford in the amount of $57,200. County without the bid received 4 bids, and Apple was the lowest bidder.
Morning, Commissioners. This truck is for the roads department. This is going to replace a 2011 Ford F550 stake body. It currently has 134,000 miles on it. Roads crews use this to transport people and materials out to the job site, holds all their signs, their sign holders, their rakes, their shovels, pretty much anything they need when they're out there on the job.
Okay, any questions for Keith?
No, with that, I'll move the Board of Commissioners award the contract for the purchase of 1 new 6-man crew cab a state body truck to Apple Ford in the amount of $57,200.
Second.
All right, all those in favor? All right, thank you. Moving on to 2 one-ton extended cab trucks with dump bodies. Mike?
Thank you. Yep, now we'd like to request your approval to award the purchase of 2 new one-ton extended cab trucks with dump bodies to Apple Ford again in the total amount of $184,390. As the bids are listed on your briefing paper there, the trucks are $92,195 a piece. Apple was the lowest bidder again.
And good morning, Commissioners. One of these trucks is going to go to facilities and it's going to replace a 2009 GMC 3500. The facilities truck is going to be moved over to the Farm Museum. We had to take the Farm Museum's truck out of service last year because of the rust and its general condition. It wasn't worth the cost to fix it. So we sent that one to auction and we're going to move this one from facilities over there. They use it for plowing and salting. And the other vehicle will be going to the landfill. Going to replace a 2009 Chevy pickup truck that currently has a salter on it. And this vehicle is being used daily use at the landfill. It's going to also be used for plowing and salting. And this one will be sent to auction because the rust on this vehicle necessitated its replacement.
What that,
Plowing and salting, rough on pickup trucks or any kind of truck.
I agree. Salting is very damaging to the vehicles. I move that the Board of Commissioners award a contract for the purchase of 2 new one-ton extended cabs with dump body to Apple Ford in the amount of $184,390.
Second.
Second.
Okay. All those in favor? Unanimous. All right, moving on to an F-250 extended cab pickup. Mike?
Okay, now we'd like to request your approval to award the purchase of a new Ford F-250 extended cab pickup, again to Apple Ford in the amount of $32,595. This one we are purchasing off the state of Maryland contract, which they competitively bid.
Again, this vehicle will be going to the landfill. It is replacing a 2008 Ford F-250 that has over 100,000 miles. It is currently used primarily by the solid waste foreman, but others throughout the operation also use this truck.
Okay, any questions on this vehicle? I'm kind of partial to Ford F-250 extended cab pickups. I'll make the motion that we award the contract for that vehicle to Apple Ford again, right, Mike? That was Apple Ford. $32,595.
Second.
Second.
All right, all those in favor? Unanimous once again. Buying a lot of trucks today. The next one is a Freightliner 114 SD roll-off refuge truck. Mike?
Thank you. Yeah, well, now we'd like to award the purchase of a Freightliner 114 SD roll-off refuge truck at Johnson Truck Center in the amount of $172,755. Again, we're purchasing this one off the state of Maryland contract, which was competitively bid.
Commissioners, this truck is also going to go to the landfill. It's going to replace a 2004 International roll-off truck, which currently has 279,000 miles. The vehicle is primarily used to haul waste and recycling containers from the homeowner use areas to the landfill or transfer stations. This truck also hauls leachate, and it can accommodate one of their portable skin-mounted leach hauling tanks.
How many miles does that truck have on it, Keith, that you're replacing? Did you say 200 and something?
279,000.
Good grief. Way overdue for that truck.
That's not many. You go a $500,000.
They last a lot longer when you don't salt and plow with them.
Yeah,
Put it on the farm. I move that the Board of Commissioners award a contract for the purchase of 1 new Freightliner 114 SD roll-off refuge truck to Johnson Truck Center in the amount of $172,755.
Second.
All right, all those in favor of this vehicle? Unanimous once again. Keith, Mike, thank you. Cliff, thanks for being on.
Well, thank you very much for the vote. And I want to just, if I can, take a second to thank Keith and Mike, and everything they're doing to help us right-size the fleet. At solid waste, we've had a number. Just looking back, we had probably 12 vehicles that still needed to be replaced as of fiscal 20. So we're judiciously reviewing everything that we have in the fleet, but also with their help, looking at ways to do rust protection and other things to corrosion protection to get these vehicles to last a little longer, at least to be in better condition when it comes time to turn them in. So thank everybody very much.
And since we're ahead of schedule now, Cliff, just a brief update, if you will, on the landfill as we continue to move through the pandemic. Things rolling right along out there. We haven't heard from you lately.
I was going to say, having trouble with the camera. No, we're doing well. The customer counts are, I don't want to say they're back to normal, but they're down significantly from what we were during the height of the pandemic when everybody was home. We're still seeing some elevated numbers here and there, but we are doing well.
Okay, very good. I know Commissioner Weaver was out there.
Cliff,
Weren't you, Dick? You were out there.
I was just out there last week, and I just want to say the people at the Scale House, I just can't say enough about what they did. The way they were helpful, they are ideal, what I would say ideal county employees. Very pleasant, helpful, trying to help everybody get to where they need to go. And just thank them again for me if you get a chance.
We'll certainly do that on behalf of the entire board. We have a tremendous team across the site. Especially in the Scale House, the Waymasters are a very tight-knit group. They look out for ourselves, they look out for the customers, but also realize that they are the first face of the county when the customers come in, and they take that responsibility very seriously. But we'll definitely pass that along. Thank you.
And Cliff, I went in stealth. I was undercover, and they treated me incredibly well. And then when I came back through again, they had realized who I was. So again, kudos to them. They're doing an awesome job out there.
Thank you very much. We'll pass it along.
Okay. All right. We go from vehicles to software. Judicial Dialogue software maintenance and support renewal. And Mike Myers, and then we'll see who else pops up here. Mike?
Great, thank you. Yep, we just need to renew our annual software maintenance and support renewal with Judicial Dialogue Systems. So we do that with the actual company, Judicial Dialogue Systems, in the amount of $25,707.97.
Okay, I don't see anybody from.
Yeah, I think we've got Kelly here from.
Yeah, I just saw Kelly pop up. Hey, Kelly, unmute. You're muted. There you go. So
right.
Give us a brief description on this one, please. Thanks.
Sure. IT currently takes care of all of our software maintenance for our Judicial Dialogue as far as billing. But the actual software itself is the main software case file system that the state's attorney uses on a daily basis for our prosecution prep, coordinating with officers. Just basically, it's our software that we use day to day to prosecute our cases.
All right. Any questions for Kelly? All right. I'll make the motion to award the contract for the Judicial Dialogue software maintenance and support renewal to Judicial Dialogue Systems, $25,707.97.
Second.
All right. All those in favor? Okay. Thanks, Kelly. Didn't need you, Bobby. Thanks for popping on, Bobby. Thanks.
Sorry, glad I could be here. Bye.
Okay. All right. That moves us to our next agenda item. And we had a prior briefing on this back on September the 24th. And that was the discussion that we had actually through our budget session previously this spring. And Commissioner Frazier was unable to attend that day. And we wanted to bring it back up again just to get the just to get the results here of what we're looking for and make the decision as it pertains to whether or not we're going to revisit the budget based on any changes that we have seen, or whether we're status quo and moving quickly. And I think, Ed, you said it earlier this morning, budget season will be here. It's right around the corner. So, I think that based on the decision, I think that's where we were going. But I wanted to give the respect for Dennis to weigh in here as well, since he was not there that day. So I know Ted's on here. I know Deb is on here. The four of us sort of discussed it at length. So to make this kind of easy, Dennis, I know you reviewed that debate that day, but I'll open it up to you, Commissioner Frazier, on any questions that you might have for Deb or Ted.
Well, to be frank, after watching it and hearing your discussion, which was very thorough, I thought, I really don't have anything additional to ask. I thought it was covered very well, and I guess I could just leave it at that.
Okay, so based on that, I think to my other colleagues, Commissioner Boucher, Rothstein, and Weaver, I believe that we got to the general consensus that day that we would be maintaining the level of budgetary involvement that we have at this point and revisit come March-ish, which will be here before you know it. Saying that, we are going to have we're working on perhaps having some work sessions in early spring or late winter to get us up to speed before we begin that arduous task again next year. But at this point, I think that's where we all were. Correct me if I'm wrong. And if that's the case, I'm not sure we need a formal vote. I think we just say we're moving on, and we'll see you all in late winter. Sound reasonable to you guys?
Yeah. I just want to thank President Wance for having the foresight back when we did the budget to set this up and come back and review this because of the situation we're in. So thank you for the leadership on that and bring it back for the public eye to make sure that we're thorough in our deliberations.
And I appreciate the fact that this was put on the agenda because I missed that particular meeting in case I had any questions to bring up, and I do appreciate that. But like I said, you guys discussed it pretty well.
Okay. All right. Thank you. Thank you to my colleagues on that. All right. We're moving on. Reimbursement from the State Emergency Number Systems Board again, and this is for phone system position relocation. And I guess, Mr. Campbell, our Director of Public Service, I'll let you set the stage. Public Safety. And Jack is on here as well. Scott, good morning. Jack, good morning.
Good morning, Commissioner. And sir, could I digress for like 30 seconds of something I know that's very important to you?
No. Thanks, Scott. Okay. No, certainly. Go ahead.
All right, and I'll take the hit for this. We should have mentioned this sooner, but this week is National Fire Prevention Week. And the theme, as you're familiar, every year they come up with a very applicable theme, and this year it's Serve Up Fire Safety in the Kitchen. National Fire Prevention Week is always the week of October the 9th because it commemorates the 1871 Great Chicago Fire. So I apologize that we didn't think to bring that forward sooner, but I think as everyone would agree that when you have these like prevention recognition events, whether it's a week, a day, a month, it really is a year-round effort. Fire prevention should not be something that we only focus on once in a while. So I apologize for not bringing it up that sooner, but I just felt it was applicable to say that we are in the midst of it. And I sure hope that the folks here in Carroll County are very attentive to their fire prevention efforts.
Wasn't the Chicago fire caused by a cow kicking a lantern or something like that?
Miss O'Leary's cow. I remember teaching about this and as a teacher in school. This time every year we're talking about it. All the kids are interested. When I was at the elementary school level, that's what I'm talking about. And we'd bring it up and we talk about cows and lanterns and straw and the fire and wooden houses and so forth. And it's so anyway, you just got me off the topic. So
Commissioner Weaver, keep your cows away from the lanterns.
Times have changed.
Yeah, that was Mrs. O'Leary's cow, and Commissioner Boucher, that became extremely political up there in Chicago. Anyway, I appreciate you bringing that up, Scott. And unfortunately, with all things COVID, some things have taken a back seat, and this is something that certainly should not take a back seat. And typically in Carroll, we put a huge emphasis on fire prevention and Fire Prevention Week, to the extent that many of our fire stations open their doors and have events to bring people in. But again, as a result of COVID, that has added a level of challenge. So appreciate you bringing that up. We need to get that word out to remind folks. And the kitchen fire thing is huge. I can't tell you how many times I've been on kitchen fires, and it can lead to a lot of damage. And I think the emphasis too is on the senior population and kitchen fires, and making sure that the safety is there for that. So thank you, Scott, for that, and appreciate it. And we want to remind all our citizens to remain in tune with all things fire prevention. So thanks. Now on to the ENSB funding, Scott.
Yes, sir. And I'm very happy to say, Commissioner, I apologize if you acknowledge him, but Jack Brown has also joined us, our Emergency Communications Manager. And Jack, am I correct? It's Maryland 911 Board is the new official title?
That's
Maryland
correct.
911 Board.
October 1st.
So as you can see, Commissioners, there's actually a change. Instead of the State Emergency Number Systems Board as of October 1, as it says in the brief, it's the Maryland 911 Board, which I believe, if I'm correct, Jack, was an attempt to standardize how these regulatory boards are recognized, so everyone would know what we're referring to, whether it's the Maryland or the Pennsylvania or whatever. Is that correct, or is this limited just to Maryland change?
It is just a Maryland change, but it was
clarification.
More clarification on the roles and responsibilities of the board.
Okay. So in the future, Commissioners, I anticipate you'll hear us coming before you, asking you to accept monies from the Maryland 911 Board. To that point, very simple, this presentation, this item is a request that you please accept $12,285.72 offered in the form of reimbursement from the Maryland 911 Board. This is a component of the much larger project to add 10 additional working consoles or workstations in between our primary and alternate emergency communications center. Admittedly, this dollar amount may not have required commissioner action, but for full transparency and because it is part of a much, much larger project, we felt it was only appropriate to come before the board and ask you to please formally accept these funds so we can continue to proceed with this very important project.
I hate accepting free money like that, but I think we should do it.
Thank you for taking one for the team, Commissioner. I appreciate that.
Is that a motion?
I move the Board of Commissioners accept the reimbursement from the state ENSB and authorize the Director of Public Safety to proceed with the work as proposed.
Second.
All right, got a motion and second. All those in favor? That's unanimous.
Awesome.
Jack, I was just getting used to that acronym, ENSB. So, now it's going to be Maryland 911, which I got to say rolls so much better off the tongue. So that was a good move on behalf of you and your colleagues. So well done. And we do appreciate the fact that you continue to be engaged with that group at a higher level, and the money that we are seeing as a result of your efforts and the things that we are seeing to help enhance our 911 centers, both primary and secondary, is good stuff. So thank you, Jack, on that. You guys are doing a great job.
Absolutely. Thank you for those words. I certainly appreciate it. And you're exactly right. The name does roll a lot easier. 911 Board it's very straightforward as to what the function of that agency.
All right, Scott, Jack, thank you.
You're welcome, sir.
All right. Next is, I think I'm right here. Am I missing something? Oh, yeah. Reimburse, this is for decontamination and disinfectant equipment for the Emergency Communications Center. Sorry, I lost my place here. We're so far ahead of schedule, I lost my place. Scott and Jack again.
Thank you again, Commissioner. With this one, sir, if you don't mind, I'd actually like to defer to Mr. Brown and allow him to explain, what this request is and the offer for $29,125, $29,125 from the Maryland 911 Board for the project that I'd like to ask Jack to please explain what it's for, this SteraMist disinfection and decontamination system. So if I may, sir, I'd like to ask Jack to explain.
Good morning. At the last 911 board meeting I attended, I brought a project in front of the 911 board asking for funding for this device. This is a highly portable, lightweight device that uses ionized hydrogen peroxide to disinfect both of the communication centers. This device is currently in use in Frederick County, and it's similar to the devices that are used in fire and law enforcement vehicles today. This was the first device that the 911 board has considered, and they did approve the request and the funding. So what questions may you have regarding the device?
I would be pretty sure this is very similar to the device Commissioner Weaver and I saw down at the convention last year, the year, whatever it was, a couple of years ago, because of the hydrogen peroxide kind of thing. It was a mister. You kind of put it on your shoulder or your back and you walk around and spray it and so forth. And at the time, the information was like, yeah, this is the device to go with. And also, I have to say that I have another system is using a device that has like a chlorine tablet that you put into it instead of what you've got, and they're having problems with it because the chlorine tablet's clogging up the mister somehow or another. So I think we went with the right device on this one.
This device was actually designed by the federal government for weaponized anthrax. It handles molds and all kinds of viruses. So it will increase the overall health of the staff that we put so much effort into trying to keep healthy. It does go in tune with the normal everyday cleaning and sanitization that still needs to occur, as well as the disinfecting of the individual workstations. But should there be an outbreak or on a regular schedule, we would use this device to decontaminate and disinfect both centers. The numbers board, the 911 board did also ask if it would be available for a mutual aid type response, and absolutely we would be on board with that should another 911 center experience some kind of outbreak.
All right, any other questions or comments for Jack?
With that, I think I'll make the motion. The Board of Commissioners accept the reimbursement from the Maryland 911 Board and approve the purchase of the disinfectant and decontamination system and authorize the Director of Public Safety to approve payment of the bill as proposed.
Second.
Okay, got a motion and second. All those in favor? Unanimous. Thanks, Jack. Thanks, Scott.
Thank you, Commissioners.
Thank you. Have a good day.
Before we get off the subject, I want to state that, earlier President Wance gave credit to former teachers Weaver and Frazier for their leadership with the Career and Technology Center. And I think a lot of credit on this board goes to President Wance, who's had a lifelong career in public safety, and he's been a very strong advocate for your department. And we're very fortunate to have him on the board, and I think you guys benefit greatly from it. Because any issues we have on public safety, he's our go-to man. So thank you very much, President Wance.
The first part of that recommendation sounded great.
I appreciate the kind words. Thank you.
You're welcome.
Okay. Thank you. All right.
I'll second
that. All right. Now we're requesting approval of transfer for the annual community self-help projects that we work on. And for that, we turn it over to Mr. Daggett, our Director of Rec and Parks. Jeff, good morning.
Good morning, Commissioners. How are you all doing today? Back for my annual visit for self-help projects. These requests come from the Volunteer Recreation Councils. They're presented to the Recreation and Parks Advisory Board. This was done at the board's last meeting on September 23rd. All of these projects are small capital projects for small improvements to park sites or school sites. And they all involve a combination of county funds, Recreation Council funds, and in some cases, volunteer labor as well. So we have 10 projects listed, and I apologize for the motion, so I'll bring that to your attention now. The motion says 9, but I can't blame it on not having enough fingers. There are, in fact, 10 projects, and I'll run through them real quick for you. Charles Carroll Recreation Council looking to do some improvements to the ball field at Charles Carroll Park, the former Charles Carroll Elementary site. $3,250 in county funds, $750 in Rec Council support. Charles Carroll Recreation Council also looking to do field improvements at Cherrytown Road, $3,211, $804 in Rec Council support. Central Carroll Recreation Council purchasing soccer goals for Deer Park. County funds, $1,828, $609 in Rec Council support. Central Carroll Rec Council again looking to do field improvements at Roaring Run Park, $3,142 in county funds, $831 in Rec Council support. Central Carroll looking to do field improvements at Sandy Mount Park, $2,374 in county funds, $631 in Rec Council funds. North Carroll Recreation Council looking to do some fencing renovations at Hampstead Elementary, $6,737 in county funds, $1,828 in Rec Council support. North Carroll Rec Council looking to purchase wrestling mats, $9,636 in county funds, $3,212 in Rec Council support. Westminster Area Rec Council has ball field renovations at multiple sites, Kate Wagner Park, Landon Burns Park, and Winters Mill High School. $3,185 in county funds, $795 in Rec Council support. Winfield Recreation Council, Mayeski Park ball field improvements, $7,019 in county funds, $2,129 in Rec Council support. And last but not least, Winfield Rec Council, Mayeski Park looking to put some dugout covers over the player benches, $1,162 in county funds, $327 in Rec Council support. It's a total of $41,544 in county funds. There's $82,000 budgeted this year for self-help requests. We do hear them at our September board meeting, and then we will entertain requests once again in February. This program's been very successful over the years. It's been in place since the 1970s. It's a great way for us to help out these rec councils and have them address some of their immediate needs. And as you can see, a lot of them have to do with ball field improvements, which improves the safety for the kids who are out there and just the overall conditions and maintenance of the fields. So we are looking for a motion today to transfer money from the self-help program into individual accounts for these projects that would be set up by management and budget. And I'd be happy to answer any questions that you all may have.
Hey, Jeff,
Go ahead.
were
Go ahead.
all rec councils present at the 23rd September meeting?
All were not present and all did not request items. You know, the invitation goes out to every rec council to submit requests. All of the ones who submitted requests were in attendance.
Were there requests that were not accepted because they fell outside of the parameters of the program?
Yes, there were 2 requests that were not recommended by the advisory board and were not approved to be included in this list. One was wrestling mats that would have been used at a private location. Self-help funds can only be used at publicly owned property or quasi-public property like Lions Club, where there is public use. Another one was submitted for some improvements at Mayeski Park. It was a high dollar request, and the cost estimate did not provide a level of detail that the advisory board was comfortable with. So their recommendation for that is to come back in February. There will be additional funds available in February, about $40,000 then. And they're suggesting that that program come back and make that request again then with some more detail.
So this is a biannual event. You do it in September, then you do it in February?
September and February, provided there's enough funds remaining. We have had years when we've had 150,000 in county funds requested in September, and we do the best we can under those circumstances. This is actually a light year for the fall.
Right. Okay, thanks.
I move the Board of County Commissioners approve the transfer of $41,544 from community self-help to 10 self-help project accounts to be established by Department of Management and Budget.
Second, but I also have a question or two for Jeff, if I can. The wrestling mats for North Carolina, are they the new lightweight mats that they're asking for?
They are the newer mats, and council is very excited about getting those. They've had a very successful wrestling program for many years. And
where is it, the North Carroll wrestling program? Is that at the old North Carroll High School?
I'm glad you asked that, because that was discussed with the advisory board as well. When they initially use these mats, they will initially be placed at North Carroll High School. They also know that usage of that facility is somewhat temporary. So the long-range plan is those mats will be moved up to Manchester Valley. And we've already had conversations with the school staff there. So that plan is already in place.
Oh yeah, that's what I want to know. And even though I didn't get the mats for my basement this time, I'll put another request in next.
Mr. Daggett, did Commissioner Frazier have anything to do with the mats being the highest number of resources in this?
Just a coincidence.
All right, any other questions on this one? All those in favor? Unanimous, I think. Weaver's a little slow. All right, got it.
Commissioner, before Jeff leaves, would it be appropriate now to mention the congratulations, recommendation, thank you letter, since it's Jeff's staff? And I have it now. I have the information, and Jeff can tell us more about the people and what they do, if you don't mind.
Certainly, we are so far ahead of schedule. Isn't it amazing? Under my direction, we are so far ahead of schedule that yes.
Who started this? I can't remember.
That's right. I'm just a puppet master here. Don't worry about it.
Go ahead.
Just smelling out. So
Go ahead, Roberta.
So recently, October 2nd, we received a letter from Ms. Madeline Flack thanking 3 staff members from Piney Run Park, Wade Blank, I'm going to turn to Jeff's email a second, since she did not have the full names of the other 2 people. Wade Blank, who is the park maintenance supervisor, Brian Dayhoff, and Tony Bassani, who are both maintenance specialists. And Jeff, I'll turn it to you to give more detail. But basically, she thanked them for their excellent maintenance and customer service at Piney Run Park. Jeff, if you want to talk more about them and the elements of the letter, that'd be great.
All right, thank you. We're very fortunate to have the staff that we do in all areas. And Piney Run, these 3 guys just do a tremendous job keeping things looking good in the park. And not just the regular maintenance and keeping things clean and available, but they're always looking for new ways to do things and improvements. They have made improvements to the trails. They've extended the mileage of trails at the park. They've added benches. They put in new picnic tables. In fact, there's a beautiful one along the trail right at the edge of the lake. So as you're hiking along, it's a great spot for a picnic. And I can't say enough about these guys and the job that they do. They have a lot of interaction with the public. So they're not only doing physical manual work, but they're also ambassadors for the department and ultimately for you all, the commissioners, when they're interacting with the public. And they do a very, very nice job of that. So again, we're very appreciative of their efforts. And this has been anything but a normal year for all of us. But at Pawnee Run in particular, the amount of visitation we've had this year has just been incredible. We're running out of rental boats on a weekly basis. When people weren't able to do a lot of things indoors, they were flocking to the parks, and Pawnee Run has had significant revenue this year from all of the visitation, but that also presents challenges to the staff as well. So I take my hat off to these guys. They've done a great job. We love hearing from the public. If there's things we can do better, great. And when we do a good job, it's really nice to hear from folks. So we appreciate that letter, and I've shared that with those staff, but wanted you all to be aware of it as well.
All right, well done. Thank you. And I'm glad you brought that up. Especially during the pandemic, I know people have gone to many, many great lengths to provide the best support for our citizens that they can. This is just a perfect example of that. So make sure you tell those guys that we recognize them today here, Jeff, and our hats off to you and your staff for continuing that effort. Thank you.
I will pass that on. I appreciate your support.
Thank you for that, Commissioners. Appreciate it.
All right. Okay, with that said, we move on. We now have additional discussion on the briefing that we had, a couple briefings that we've had now on the annexation in Manchester, annexation number 39, which is the Lippy property. A number of reasons why we wanted to do this. There were some questions that we had that kind of went unanswered, and we wanted to make sure of where we were going with this. That's number one. Commissioner Frazier was absent, and we wanted to make sure that he chimed in on this as well. And in general, we wanted to make sure that we were on the same page here, because at the end of the session last time, we were advised that I think Planning and Zoning in Manchester is against this. So it sort of put more questions in our mind. So Linda, I'll turn it over to you or Claire or whoever, just to briefly bring us up to date. We don't have to go over this whole thing again, because Dennis has looked at that discussion that we had. So if you could just hit the highlights for us, so we don't have to go through the whole presentation again.
Well, good morning, Commissioners. And again, as Commissioner Rand said, we are here for the finalization of the comment letter to forward to the town of Manchester for annexation number 39, the Lippy property. Today we have with us Michelle Wilder from the town of Manchester, as well as Steve Miller and Claire Stewart, who prepared the staff report. Based on the discussion last week, we modified the comment letter and removed the favorable recommendation. So if you have the comment letter in front of you and refer to number 8, we are just simply forwarding the Board of County Commissioners support the mayor and town council's final decision. So basically supporting whatever for the town, and then having reviewed the Carroll County Planning and Zoning Commission's report and recommendation, the Board of County Commissioners voted to forward the comments outlined in this letter and approval of the zoning waiver request to the town of Manchester. So again, just leaving it that this is more of a comment letter from other agencies that we are acting as the conduit to forward this information to the town, and to also have the Board of County Commissioners issue the zoning waiver as requested. So if any other questions for the town, they are here to provide answers to those.
I think that when we ended this last time, we were concerned with the wording in the letter that was being sent. And number 8, as I'm reading and looking at it, seems to address what we felt at that point. I don't know how everybody else feels, but I think that, that kind of answers, what we wanted to express in the letter.
Yeah, you're right, Dennis. Yeah, you're spot on because we were concerned about those various issues that we put in number 8. So that's there. So my only question is, again, on this, I want to make sure that we're not putting the cart before the horse here. We're forwarding our comment letter, and we're also approving a zoning waiver request. Can you explain that part of it, please? Because I thought we were just forwarding the comment letter for Manchester then to take the lead in this.
So I think my understanding of how the discussion went and was that you all still were going to do the zoning waiver. That way it gives the town the option whether or not to rezone without the zoning waiver attached with this. If for some reason the town does choose to annex the property in and do the rezoning without the zoning waiver, they would be held to a 5-year prohibition on rezoning that property. So this gives the town the flexibility to make this decision if they so choose to rezone at a future time.
Okay, so we're not forcing their hand by adding the waiver request.
No, we are not.
No,
Okay.
and also, if they decide not to annex, the land stays how it's zoned right now. The zoning waiver doesn't affect anything unless they annex it.
Correct. And the zoning waiver does not give them the zoning. It's not rezoning the property. The town would have to actually go through their rezoning process in order to rezone the property. So simply by annexing it in does not rezone the property. They actually need to go through their process then to rezone the property to the town zone because they will need to have town zoning on that parcel.
Does the approval of the rezoning waiver request have to be in there?
This would be the appropriate time for the rezoning waiver. And again, it just gives the town the flexibility to rezone the property in accordance with their master plan.
Correct. Just because they can doesn't mean they will. It just gives them the allowance to move forward. So, I mean, if we're going to do one thing, we should do the second. You give them the full opportunity to do what they want to do with the property. Is that right, Linda?
That is correct.
Unusual, but yes.
I'll move that the board sign and forward the comment letter to the town of Manchester regarding annexation number 39, Liberty property.
Second.
Okay, I've got a motion and second. I still have, I still don't know that I quite understand this process. These decisions should be absolutely up to our municipalities. So I want to be clear again that by us stating, and maybe I'm asking it too much, but I don't quite understand it yet. By us giving them that waiver, that zoning waiver, we're in no way making a decision. We're only, see, that's where I'm getting lost here. I thought we were going to give them the comment letter. That's where the discussion was going last week. We're merely giving comments, but now we've taken an additional step and now we're giving them the zoning waiver. I don't understand why that's not further down in the process after the town decides what they want to do.
I think it's just giving them the authority. It's not, we're not saying you will do, it's just giving them, I mean, the ability to move forward. But again, just because they have that doesn't mean they're going to do that. And we're in no way saying you will do something. It's just giving them, as opposed to doing it and then them coming back for that authority to rezone. Is that right, Linda, or am I?
Why would that be now?
Dick, what was your question? I'm sorry. What was your question, Dick?
So why would that be in there now? I mean, does that have to be part of this letter? I know you're trying to save steps, but I think the only thing we're worried about is the annexation. Let the town make that decision Any requests that, does that make sense, Steve?
Well, that's kind of where I am with you as well, Dick, on that line of thinking. I over the 6 years that I've been here, this hasn't happened a lot, but I've questioned it before, and it just sort of went whoop. But I had this discussion, a lengthy discussion, with a previous person who worked in our planning department. I don't understand why we're taking the step that we are. We're merely just giving them the comments right now. And then I think it should go back to the town, let them decide, then bring it back to us, and then let us give them the waiver request. Is it that a time-consuming an item? Because this has the perception of us saying, yep, you're good and we're good. And I'm not so sure that we are. Crickets.
Well, I'm not an expert in this field, and I've never seen the county do it that way. But keep in mind, annexation really is a totally town-driven process. So the county, if the town wants to annex property and it meets all the criteria, then the county cannot say no to an annexation. The power the county has, if we want to refer to it as power, is whether or not to grant the zoning waiver. If you do, you have absolute discretion to not grant the zoning waiver, and then that prevents the town from rezoning the property. They can still annex it. They can still annex it. But if you do not grant the waiver, the town cannot change the zoning for 5 years. On the 6th year, they can change the zoning if their property, in their town, and they can change their zoning. So that's what the zoning waiver does. So you sort of don't really have a dog in the fight of the annexation. If the town wants to annex the property and it's in their municipal growth area and some other things, they can do so. The question is whether or not, if there's a conflict between the existing county zoning and the town zoning that the annexation requester is requesting, then they have to ask, the town has to ask for a zoning waiver.
Okay.
You, as the Board of Commissioners, do not have to grant that. If you do not, then they have to wait. They, being the owners of the property, have to wait for 5, and the town have to wait for 5 years to rezone.
Okay.
I don't know whether that's ever done in a bifurcated manner. That's the only thing I don't know. And I think Linda for that.
Okay, and I think this is a different situation as well, because I can't remember the last time in the 6 years that I've been here that a zoning request came in and the town planning and zoning said, yeah, we're not interested in doing it. But yet we're still going through the process.
So we actually had this happen several times before, where most recently it was the Sykesville Raincliffe. They needed a zoning waiver. We went through the process and the town ultimately did not annex that property in. And this is just part of the process that's set out for us under Maryland law that we're just following, that the zoning waiver goes with the annexation request.
Okay. Okay.
I appreciate Administrator Wyndham's expertise and knowledge on this, because I was looking for a legal opinion and some knowledge. I also appreciate President Wance's concerns about this, because I emphasize his position on this. I'm facing a potential annexation in Mount Airy, and I'm learning as I'm going, and I've had some misconceptions about it. It gets quite confusing, as President Wance states, some things they seem out of order to us, but there's legal language behind it. And on this decision particularly, I'm going to follow the lead of Commissioner Wance on this, since it is his district, and what you want, I will vote on for you.
I like everything except for an approval of zoning waiver request for the town of Manchester.
So if this is a
hung up with that, Steve, same as you are. Yeah, I'm still.
Yeah, I'm getting there. So what you're, Roberta, what you're saying, and Linda, what you're backing up is, this is the law. We have to give them the waiver, the waiver request.
No, you have to give them the annexation, basically. That's the law. Your choice is whether or not to waive the zoning and allow them the flexibility, as Commissioner Rothstein said earlier. The waiver allows the town to rezone the property anytime they want after they annex it. If you prohibit the waiver, if you do not agree to the waiver, then the town has to wait 5 years, and the owner of the property have to wait 5 years before they can rezone the property.
Okay. So essentially, Dick, you understand.
I'm sorry. I was going to read to you the actual information from the Maryland Municipal League Handbook, and they're quoting of section 4-416, zoning within annexed area. So it says, without the express approval of the county commissioners or county council of the county in which the municipality is located, for 5 years after an annexation by a municipality, the municipality may not allow development of the annexed land for land uses substantially different than the authorized use or at a substantially higher density, not exceeding 50%. Then could be granted for the proposed development in accordance with the zoning classification of the county applicable at the time of annexation. So that is why it is following with the annexation request. So if you do not approve the waiver, I don't believe, and again, I'm not an attorney, that they can come back and retroactively request the zoning waiver.
Correct. And that's, again, that makes sense, Linda, what you shared. And to me, it just makes logical sense that if we're doing one, that we give the tools, the appropriate tools to the town to do the work they need to do once that piece of property is annexed. If not, then why would they want to annex that property and not have the ability? We're not giving them the appropriate tools. And that's what this is. This is giving them the appropriate tools for them to manage the property appropriately once it's annexed in to Manchester. So yeah, I stick by definitely the motion made.
May I speak? I'm Bradford Webb, counsel for the developer, and I'm the one who filed the petition.
Yeah.
Sure. Waiver.
Sure, Mr. Webb, go ahead.
Thank you. The waiver is a request that we made at the invitation of the state of Maryland when they reviewed the annexation proposal submitted by the developer. They noted that in, I guess, 2 or 3 of the zoning areas, they were consistent with the Manchester zoning classifications and had no issue. There's 5 acres of this property that's in conservation. And they suggested we seek the waiver from you to then allow Manchester to change the zoning to be consistent with their master plan, which has it, I believe, at R20,000, something like that. Is that right, Linda? Yeah. Keep in mind that it's conservation because I believe there's a stream going through that area. And no matter what, when the site plan is prepared, there's going to be a stream buffer along that stream that will not allow development. There will be no lots within the stream buffer. And that's going to take up a great deal. Yes, sir.
I'm going to stop you there, Mr. Webb, because we're not here to debate the what ifs of the property. We're merely debating, I think, here today, the process. So, you know, the rest of that will come in due time, and I understand that. But what you're presenting is more suited for when it comes before the town of Manchester, not us.
I was just speaking as to give you the background of what the scope of the waiver is, and it's only one small part of the annexation request, and is minimal consequence down the road. But
Okay.
the procedure is in all annexations, and it's the law, that when there's land that's in the county now, and it is proposed to be annexed into the town, the waiver comes before the annexation. And that's the process. And there's no methodology for the town coming back later, or even, and the town doesn't even ask for the waiver. It's the developer that asks for the waiver. That's what the law says, and that's what we've done.
Okay.
All your other comments are comments that you would like the town to take into consideration, but I think it's understood they can take them or leave them, because annexation is their decision. And of course, a lot of these comments are really things that will be brought up more appropriately at the site plan process when the property goes into that part of the development. We're simply not there yet. Annexation is just the first part. We're trying to take a piece of property that is an enclave. It is already surrounded by the town of Manchester. Enclaves are against public policy. They are not preferred.
I'm going to try to.
Okay.
We understand
Okay.
what you're saying. Thank you.
Okay.
Yeah.
But the long and short of it is, if the waiver does not go with the annexation, it's not going to happen. The waiver won't happen. They'll have to wait 5 years. And that's the long and the short of it. So either we send a waiver with the letter and comment letter, or they're going to have to wait 5 years to rezone it, because there's no process for them to come back and ask for it at a later time. So
Yeah,
that's
that's
what
right.
we're looking at right now.
Or just to clarify, it's only
Linda,
I'm sorry.
just bear with me a second, because I want to make this very clear. We are making a decision, not with a developer or an individual. We are making a decision with the town of Manchester to provide the town of Manchester the comments that have been, given, and then the motion and seconded is to allow for a planning and zoning waiver to be provided, again, those tools for the town of Manchester. This has nothing to do with a developer or an individual. And this is to allow Manchester to do their job. I just want to be very clear on that.
Okay, Linda?
Yeah, I'm sorry. I'm having trouble with my camera, so I apologize, Commissioner Ross. I did not hear you talking. It's been a little squirrely. But anyway, what I was going to say is the zoning waiver is only for a 5-acre portion of this property. And it's only for the portion that Mr. Webb had said is the conservation portion. The rest of the property does not require the zoning waiver for the town to put into their equivalent town zoning, just the conservation piece.
Okay. All right, very good. I think we've vetted this to the nth degree. I'm comfortable with this moving forward now that I've gotten the explanations. Ed, you made a motion, and it's been a kind of a lengthy debate. Did we get a second?
Yes, I second it.
Okay. All right. So I do have a motion and second. Commissioner Weaver, are you good here?
Yes, as good as it's going to get today.
Okay. All right. All right. I want to thank everybody. I mean, this has been an interesting process, and I think it's opened our eyes to the actual steps in this process. And I want to thank those that have provided the answers, because again, I was a little bit taken back when Steve Miller came on and said, "Yep, well, hey, by the way, they're not in favor of this at this time." So that just sort of threw a wrench in it, and that's why we sort of wanted to take that right turn and make sure we were doing it the right way. So
this is still totally up to the town, correct?
Absolutely. Yes, it is. Yep. Okay. All right. With that said, I've got a motion and second on the floor. All those in favor? All right. We've got that unanimous, Linda. I know it was a tough couple weeks to get there, but thank you and Claire for guiding us through that. Mr. Webb, we appreciate you coming on today. Steve and Michelle, thank you very much, and we'll keep our finger on the pulse of this project as it continues to move through Manchester's process now.
Thank you. Have a great day.
Thank you all very much.
Okay.
I think this was a little bit of a test run for when Mount Airy comes in front of us. This was very educational for me. I'd like to point at the end that basically we're turning the autonomy over to that jurisdiction to make that final decision.
Yeah, which is absolutely the way that it should be. And that's why I wanted to make sure, and so did Commissioner Weaver, that was indeed the case. There was some language in there that would have contradicted what that should have said. They're what you're saying. And we wanted to make sure that that was struck out of there. And if we would have left it alone, the language would have said, we're giving them the ability to do it. And that's not what I wanted them, or we're telling them that they should do it. And that's not what I wanted to happen. The emphasis has got to be on our municipalities. Okay. I don't have anything else on here. Interesting. Do we have any public comment, do you know?
None that I can see.
Okay. Chris, no? Okay. All right, with that being said, we'll go into open admin. I got to keep track of my paper. I got papers in front of me and I still can't keep track of where I am.
Commissioner, I'm sorry. We do have approval of a closed minute statement.
Right.
Say that again.
Yeah, that's Chris, that's part of open admin. That's okay.
Okay.
Yeah.
Thanks. If Mr. Webb leaves the meeting, we're having some bandwidth issues. If Mr. Webb would leave the meeting, it would help probably. Thanks.
Can you make that happen, Chris?
Working on it.
Thank you. All right, we're going to move into open admin. Before we get into agendas, let's do, or anything else open admin, we do have closed summary of closed minutes as a result of a closed session that we had on October the 1st. I know you've all had the ability to be able to go through those, and I would ask now for a motion and second to approve those closed minutes.
Make a motion to approve the closed minutes of October 1st.
Second.
All right, any questions on the minutes? All those in favor? Okay, that's unanimous. All right, now, open admin, items for open admin before we run down through upcoming agendas.
I do have one thing I'd like to put forward. It's brought to my attention, you know, we have all the volunteer fire departments, 14 of them out here. And we are now starting the Carroll County Fire Department, and the combination is going to be coming together. But we still have a lot of volunteer groups out here working to build their stations, to keep working toward things. And they spend a lot of their year raising money. And as they develop some projects, you know, they come into us to review those projects, whether for whatever. And yeah, I think it's not quite appropriate. You know, we're taking funds from them that they've raised to review their projects. I would love to waive the fees for our volunteer fire departments for their development review and those type things, instead of taking money from them that they can use for the community at this time. So what I'm asking for, I guess, is a waiver of fees for volunteer fire departments as they develop, you know, add-on or whatever happens to their departments as we start to evolve and move into the combined systems.
So, of course, I'm going to totally agree with that, but I think there's been instances in the past where some of those fees have been waived for building permits and things like that, but I'm not sure if that is ever been set in stone. I think it might have been a case-by-case thing as they came through. So, Roberta, is that something that we can check into and put back on the agenda? To check on that, because listen, the amount that we're going to get, it's not a lot. but it's a matter of respect, I believe, to just waive that. And it's a good point, Dick. We give them and then we taketh away. So it doesn't really make a lot of sense there. So let's check on that.
And they're doing a public service. Yeah.
Yeah.
And they're doing a public service for us. They're out working hard, donating their time, and yet we're taking the money that they have to raise to help them and support our communities. And I wanted to do it countywide. I did have a request from an individual on this, but you know, all 14 fire departments are valuable to this county, and they are going to be for years to come. So I thought, why should we take their money if we don't? We should be working in this together as a county and the volunteers and our new fire system.
Okay, Roberta, let's put that on the agenda. Let's check on making that a direction moving forward, what we'd have to do that, to waive the fees for our 14 volunteer fire departments when it comes to their, whatever the county fees are. I don't think there's a lot, Dick, but I think you're right. The building permits and things like that, I think are on there, so.
Yeah,
Maybe
I
it would
agree
help.
with my colleagues. I think it's a good idea, but it'll be important for the public to see your staff produce some sort of reports for what the historical collection was in the past. Now it could impact us in the future just for public exposure, but I'm in support of this idea as well.
Okay. All right. Anything else for open admin? All right, let's roll down through our agendas for the upcoming 2 weeks. The week of October the 12th, a reminder that the county offices will be closed in observance of Columbus Day. On Tuesday, October the 13th, I have a shock trauma board meeting at 8 a.m., virtually, of course. At 10 a.m., there's a planning work session on comp rezoning and commercial industrial employment campus properties. That's a work session that all 5 of us will be attending that day. And at 7 p.m., I have an Ag Center board meeting as well. Wednesday, the 14th, Commissioner Frazier has Board of Education meeting at 5 p.m. Thursday, October the 15th, a little change in time here. Please note, myself and Commissioner Rothstein will be attending the BWI Partnership virtual meeting. And as a result, and that's at 7:45 a.m. As a result of that meeting, we're pushing our open session to 10 a.m. that day. And right now on our agenda for that day, the only thing we have is Violence Against Women's Act grant award. But I'm sure we'll get some more. Those lists always grow, but that's all that we have right now. On Friday, October the 16th, I have a Baltimore Metropolitan Council meeting virtually at 8:30 a.m. And Commissioner Boucher has the podcast for that week. All right, the week of October the 19th, Tuesday the 20th is the continuing chamber business breakfast, and apparently this one now is going to be in person. So Commissioner Frazier's District 3 chamber business breakfast is going to be in District 1.
Makes it special.
I do what I can to include all the districts.
Uh-huh. Okay, that's
I
it.
think Freedom have its own district.
That's it. That's at 8 a.m. At 9 a.m., Planning and Zoning, Commissioner Rothstein. 2 p.m., Veterans Advisory Board meeting, Commissioners Rothstein and Weaver. Wednesday, October 21st at 4 p.m., Commissioner Weaver has Carroll Community College Board meeting. Thursday, October 22nd, we go into open session. We've got a couple ag preservation options, and that's all we have, but I'm sure that will grow as well. At 7 p.m. that evening, Commissioner Weaver has the Finksburg Planning and Citizens Council meeting. That will be virtual. And Commissioner Rustine has the podcast for that week. Any additions or corrections to the agendas? All right. Anything else?
No additions or corrections, but real quickly, I just want to tell any staff members out there, since I'm doing the podcast next week, if there's anything of important interest to the community at large you want me to share, please get it to me and I'll share it with the public.
Okay. All right. Nothing else for open, right? If not, we need to go into closed, an administrative session for closed. That's going to be closed. So right now, I will entertain the motion to go into an a closed administrative session.
Motion to go into a closed administrative session, and following that, motion to adjourn.
Second both those motions.
One at a time. One at a time here. Gee. All right. Motion and second to go into a closed admin. All those in favor?
Aye.
That's unanimous. And then motion to adjourn after that. All those in favor?
After that.
Okay, very good. Thank you very much. A reminder to everyone to have a safe weekend and remain vigilant as we continue to move through the pandemic. And it is Fire Prevention Week. Thank you to Director Campbell for pointing that out. So make sure that you paying attention to what you're doing out there. Be aware of your surroundings. All right, with that being said, we are adjourned, and let's wait until we have the breakaway and we're given the assurance that we are in closed, and then we'll continue with our closed session. Thank you, everybody.